So I just want to start by saying welcome to Northern Arizona University here in Flagstaff, and thanks for coming to you all here in person. And then also we have a number of folks that are joining us online. So we're excited for this conference today. This is the fourth in our series of workshops this year that are supported by the Arizona Biomedical Research Center and also brought to you by NAU's Center for Health Equity Research. My name's Steve Palmer, and I'm a professor in health sciences at Northern Arizona University, and I'm one of the co-leads, along with Dr. Bob Trotter, who I believe is joining virtually today. We want to start by thanking John Garcia from the Arizona Biomedical Research Center. He will have some things to share with you here shortly. So he's here online as well. John, thanks, and the ABRC for supporting this and the other education workshops presented this year. I want to thank Nick Beckett. He was handing out your name tags outside. Yes, thank you, Nick. He has been instrumental in just helping get all of this to happen and happen smoothly, along with Aaron and the rest of the AV crew. So thank you all. Before I introduce the leaders for today's workshop, I'd like to mention the past and also our upcoming events in this series through NAU. Our first workshop that we held this year examined the research and characteristics of the healthy zones. We call them the blue zones. We then had a conference on developing a rural healthcare workforce, and that was a collaboration between NAU faculty and also faculty from Texas Tech. That was held down at the Phoenix Bioscience Core in downtown Phoenix. Last month, we hosted a conference on lessons from the pandemic, where we examined what happened, what we messed up on, and then what we could learn from the pandemic moving forward, from a media, a political, and also a policy perspective. Finally, next week, we're returning to Yuma for our 5th annual forum on collaborative partnerships, translating research to practice. That one is really led by Amanda Aguirre, who is a past state senator. So we're looking, if you're interested, you could go to the ABRC CHER website, and that one's in person only. And we've got like 120, but if you want to go to Yuma, it's going to be a fantastic event. Anyhow, so today, this conference focuses on child health with really a lens looking more toward student and child success in schools. This is a collaborative offering between NAU's College of Health and Human Services, the Center of Health Equity Research, of course, and the Department of Health Sciences at NAU, along with NAU's College of Education. And then we have our co-planners here from Coconino County Health and Human Services, Kim Austin and Teresa Kopinski. As you all know and are here, it's because you are aware that there's a direct connection between child health and academic achievement. Today, school-age children from PK through high school, they generally are exhibiting more anxiety, depression. They're less physically active. They have poorer nutrition than past generations. And COVID really kind of brought a lot of that. It made it worse, right? Schools and teachers are asked to do more every year. They can't just teach. They now have to be counselors. They have to be mediators, coaches, and beyond. And the whole school system is charged to do more today than we have ever expected of our school personnel. Meanwhile, we have, of course, our political nightmare out there that happens in schools and, you know, this divided country and living off emotion, right? But today we're going to examine what do we know about kids and the importance of health. So the CDC's whole school, whole community, whole child model really holds the child, every child, at the center of the model and identifies 10 different components that leads to kids being successful through schools. Today, we're going to examine more directly, really, I should say there are tremendous efforts from school systems and beyond, including the communities, because it does take a community to really help every child succeed, right? And that's where we have folks from a wide variety of institutions and organizations here today from Coconino County. We have folks from ASU. We have folks from Tuba City Regional. And I will introduce all these other folks as we get up to it. But anyhow, so we're going to really examine and dive deep looking at physical activity, nutrition, and mental health, those areas today. So I'd like to start by introducing our co-hosts for today. They don't have to say anything, but please give it up for Teresa Kolpinski and Kim Austin. They helped plan this workshop along with Tori Damjanovic, who will be here shortly. She's got a whole bunch of other things going on today, but she'll be here in time to moderate our mental health panel. The conference, as I mentioned earlier, is supported by the ABRC. We're fortunate to have John Garcia, the ABRC program director, here with us today to share a bit more about ABRC research and education support. So at this point, John, can I just turn it over to you?
It's a pleasure to be here today, at least virtually. I think I'd rather be up there than down here because it's starting to get hot. I was just trying to get a read on the temperature, and I know it says it's 96 degrees here in sunny Phoenix. So I think Flagstaff would be a far better place to be. I have to echo exactly what you said about the subject for today's conference. The overused adage of it takes a village to raise a child, is still true. And you think about it, that children are in the education system 6 to 8 hours a day. And educators probably know more about that child than some of their parents. And, a lot has changed since I was going through the K to 12 system because, we were kind of on our own, it seemed like at the time. You had a school nurse, maybe. You had a school counselor, maybe. And then you were just left on your own. You get bullied. Oh, well, work it out. You're depressed. Well, take it home. I don't want to deal with it. And I think that, today we're finally seeing how desperate children are in our educational system. And if a child is in a good place, they're going to learn. If they're not in a good place, they're probably not going to learn. And this is our future. And it just drives me crazy that, we're not all working together, parents, community, support services, that we're all not working together to get this child in a place where they are safe and they are getting the nutritional support and the emotional support that they need to survive the educational process, and so that they can become thriving, productive citizens of our state and country. The Arizona Biomedical Research Center, and I have to apologize for my throat. I'm fighting this allergy, head cold, bronchitis, whatever thing that's been going around. So I just sound a little bit of a gravel gertie today. But the Arizona Biomedical Research Commission was established in 1984 by statute from some future-thinking legislators who believed that we needed a mechanism to identify and support innovative biomedical research that was going to improve the health of all Arizonans. In 2011, they abolished the commission model and moved it into the Department of Health Services, and there it became the Biomedical Research Center. We are charged with three programs: providing research, providing funding for biomedical research. And that's given out in the form of grants once or twice a year, depending on the amount of funding that we have. And and then supporting research education. And that's what this program is funded under, because we firmly believe that our educators in the graduate and postgraduate schools need to keep up on their skills. The state of the art, the state of science changes by the hour, and so we need to be able to provide a mechanism for uh, educators, professors, researchers, staff, faculty, students, and the public an ability to um, get the best and latest information that we can possibly bring, and to to engage in the conversations that we need to about public health, just like we're doing today. Um, the other program that we are charged with providing support for is the um, Arizona Public Cord Blood Program, and that basically exists so that we can encourage expectant mothers to donate their baby's umbilical cord blood and any placenta blood that remains. This is taken, processed, stored, and put on national registry, just as if it were bone marrow blood. And this is a life-saving nectar in a way, I have to say, because there's over 80 diseases that the stem cells in the umbilical cord blood is able to help cure or treat. And I've met so many survivors from cord blood transplants that they were afflicted with, really a death sentence when they were young, and today they're alive, they're well, they're active, they're functioning, they have jobs, they have families. So we know that this works, and what we do is we try to educate the public, doctors, nurses, that cord blood, stem cells from cord blood, can be a life-saving fluid for so many people, because in dealing with bone marrow transplants, you have to have an exact match or pretty close to an exact match. With cord blood, you don't have to have that exact match. You only have to have so many points out of the HLA scale to get a match. And they're coming up with better ways to expand the cord blood so that transplants can be given to adults in greater amounts, which just helps with the healing process. So that's what we're all about at the ABRC. We get money from two different sources, and I love to brag about this because we're basically taking money that is used for smoking. Our disease control research fund takes money out of the lottery pot. Our health research fund takes money out of the tobacco pot. So when people are buying those, wow, it's getting worse. Hold on a sec. Okay, I think that's going to be a little better. So when people are buying those horrible packs of cigarettes and stuff, they're supporting our mission to provide research funding for cures for things like cancer and other tobacco-related diseases. When people are out there, scratching those scratchers and buying the Powerball tickets, they're helping us provide funding for research education and the cord blood program. So, go out there, buy some scratchers. I won't tell you to go buy some cigarettes, please. Don't do that. But we like the support as much as possible in our two funding sources. If you're ever curious about everything that we do, we have a website. It's on the ADHS site, so it's adhs.gov/biomedical, and we have information on our research grants, research education, our annual reports. We publish a directory of all the institutional review boards, IRBs, and then we have the cord blood program. So you're welcome to visit that. We are coming up with, and I hope it's going to be like next week, that we're going to release a solicitation for another $9 million round of research grants. So keep an eye on our website. If you go to the events tab on our website, keep an eye on that for future announcements of the release of that solicitation. So I can't tell you exactly when, because there's a lot of different factors involved in getting these things published. So that is about all I'd like to say, except just thank you. Thank you for being here in person or virtually. This is an important topic, and I can't wait to hear our speakers today and what they have to offer, and get this conversation going so that we can make an impact, and really save our future. I think that's the biggest takeaway, is that we could be working on a way to save the future by getting the community and the educational system and parents all together on the same page about their child's health, nutritional support, well-being, so that they can excel in the educational system. Thank you very much. Enjoy the conference.
All right, folks. John, thank you so much for your comments, and also really the support of the ABRC and really supporting the health of Arizona communities. So I want to point out on each table, there's a sheet of paper with a QR code. And if you have any ideas for ways to get involved, topics that we want to maybe explore or network later, feel free to just go to that spot or that site and put in whatever. And you can do it throughout the day. And then we're going to do something with that at the end of the conference. So anyhow, I'd like to introduce Carrie Sheff, the first speaker today. She's really going to set the stage for us. Carrie currently serves as a Title IV-A Safe, Healthy, and Active Student Specialist for the Arizona Department of Education. And I'm just going to turn it right over to you. So thank you so much for coming.
Right. Pretty short. I don't know. You guys might be able to hear me without the microphone. I am a PE teacher, so that is what I used to do for a living. I've been at Department of Ed now for 12 years. There's some pretty familiar faces in the room, so it's nice to see everyone. And for those of you that don't know me, as Steve said, I'm Carrie Sheff. I'm Title IV-A Safe, Healthy, and Active Student Specialist at the Arizona Department of Education. Prior to that, I was in Health and Nutrition Services at ADE, where I know Taryn. It's nice to see you. And then I was a high school physical education teacher down in Surprise in Glendale, Arizona before that. So my passion is getting kids active, but really understanding what that looks like, right? I think there's a huge gap in the education world in realizing the need to connect to public health. And there's a huge gap in the public health world of understanding how to connect with schools, right? So anytime we can bridge those two things together, I think it's really important. So the conversation that I'm going to have with you today is about school funding. Because we all know we want our schools to support nutrition, physical activity, mental health, and all the things associated with all of those. But that takes money at school sites. There's a lot of things that schools can tap into that are free, including the services from our public health departments, from the county, from ADHS, from all of our other supporting agencies, from the healthcare system. But I feel like those resources can only go so far. So when we don't engage our school leaders in how to fund the rest of those things, that's where we fall short. So that's what this is going to be, like a little journey in school health. So first and foremost, when we're talking to teachers about how to fund things in schools, or if we're talking to administrators, school board members, principals, superintendents, whatever, school nurses, food service directors, whoever's involved in that conversation, it's important to recognize there are some easy wins, right? There are some easy places to get funding, and there are some more challenging places to get funding. First and foremost, start with your local school budgets, right? A lot of times there's money in there for some programs, and it might not be fully tapped into. So that's a great first place to start when you're talking to the school nurse, the teacher, the food service director on how they expand or improve on programs that they have. I think a really good place that is often overlooked is your parent-teacher organizations, right? If you can get your parent-teacher organizations on your side to do fun runs and physically active fundraisers, it supports, right? Nutrition-based fundraisers. Like, there's things you can do. We all know the cookie dough challenge, right? And that it makes so much profit for our schools. But what message is it sending to our kids, right? Or are we doing a nutrition lesson, if that is our fundraiser, because that's what the parents have decided and that's what really works well in that community, and it raises money? Are we then counteracting that with some positive messaging around physical activity and nutrition so that we can make sure that those messages are coinciding with each other, right? I know that a lot of our schools in Arizona are not tapping into Health Moves Minds. Health Moves Minds is a fundraiser through Shape America. For those of you that don't know, Shape America is the Society of Health and Physical Education. And so basically, it's the governing body, per se, of health and PE teachers across the country. And they have a wonderful fundraising program that took the place of Jump Rope for Heart called Health Moves Minds. So if your schools are looking for something that's quick, easy, maybe smaller amounts of money, they need to buy equipment, or they just want a quick win, those are some good places to go. And then, of course, Fuel Up to Play 60. The Dairy Council of Arizona does a great job of working with our schools to do nutrition and physical activity. The best part, I think, for me about Fuel Up to Play 60 is it's student-led. So it's the students that do the work and the students who are rewarded when that work is done. They obviously need support from the food service director. They need support. It's typically from a physical activity champion on campus. It might be the nurse. It's a lot of times the PE teacher. It might be a principal or a classroom teacher, but it's really the students that are driving those efforts. So those are some like state and local things that schools can do. And then we're going to tap into the federal things. So there were, do you guys remember when during the pandemic when you got 3 large sums of money dropped into your bank accounts, care of the CARES Act, right? Guess what? School districts got those same 3 checks, except their checks were in the millions. And they were specifically designed for COVID relief, right? And so what that meant is schools could pretty much do whatever they wanted with those funds. We had schools that created buses to take food out to kids that were in more rural areas, like our students on the reservation, right? We had buses that got Wi-Fi routers installed on the buses, and they took the Wi-Fi to the students that didn't have working Wi-Fi in their neighborhoods, right? So we saw all kinds of really cool things, but what we also saw was the ability to buy equipment in areas like art, music, and physical education, right? Where there might have been 6 or 7 balls that a class was sharing before. That's a major health concern during COVID. And so it was an opportunity for our PE teachers to say, hey, we need a basketball for every student in the class. So that we now have a class set of 35 or 36 basketballs that's available to our students, as opposed to 5 or 6 that we might be sharing. We also might need more supporting staff, right? Because it was kind of hard for those teachers, if they were limited staff, to navigate reaching all their students, even virtually. So it gave schools flexibility and opportunity to really fund these things. Yeah, so when we're talking about some of the rounds of funding, and I'm going to break down the ESSER funding a little bit more on the next slides because it was super exciting. So those were like emergency funds. These funds right here are common funds that anybody can use in a Title I school. So raise your hand if you work with Title I schools in your area. Right? Most of us do. Most schools in Arizona, it's something like over 80% of schools in Arizona are Title I schools. So Title I money is always available, and Title I money can fund nutrition, physical activity, and mental health supports in schools. The problem with Title I funding is it's limited to Title I students. So unless they're running what's known as a school-wide program, they can only fund Title I students, right? So if you're using Title I money to fund a school counselor, they might not be able to work with students that are not Title I. And Title I really is tied to academics. So most of Title I money goes to, what do you guys think? What kind of teachers do you think they fund with Title I money? Math, English, science, social studies. Sometimes we'll get art teachers in there. Sometimes we'll get physical education teachers in there. But as a whole, it's usually reading intervention, those kinds of positions. So they're finding a lot of instructional aides and whatnot. So that's a great source of money, but it isn't always available. And it's usually always earmarked because that's the first pot of money their schools spend because it's been around the longest and it's just, they just keep doing what they've been doing. If I'm being honest, right? If they've funded a math teacher for the last 10 years with Title I, they're probably going to keep funding that math teacher, right? Because that's just how schools work. Title II money. Title II money is professional development. It is specifically earmarked for school staff to get professional development, and that's all school staff, not just teachers, right? So we're looking at school nurses, counselors, physical education teachers getting professional development that is specific to PE, not just general education, right? So that can come out of Title II. It includes retention stipends for teachers and all kinds of things. It's a little bit more broad, but as a whole, it's designed for professional learning for teachers and school staff. And then Title IV-A, that funds everything. And every kid in the school district can get Title IV-A funding without any questions. So it doesn't have to be Title I schools. So the benefits of Title IV-A is every kid can get it. It's not specific to Title I, and it's an outside-the-box grant. So everything you're talking about today, including all 10 components of the WISC model, can be funded with Title IV-A. And if you want to know more about that, I actually work in Title IV-A. I'm a grant reviewer. That's my job. We can touch base after this. So, and then Title IV-B is after-school programs. Some of you might know it as 21st century after-school programs. That's Title IV-B. So it's an extension of Title IV-A. Basically, anything that you're funding with Title IV-A can be funded with Title IV-B and vice versa, especially after those programs end. So here's that CARES Act I was talking about earlier. The first round's already spent. It's already expired. The second round, schools probably have it totally earmarked by now because it ends September 30th of 2023. But the last round of ESSER funding does not expire until September 30th of 2024. So if you're working with schools and they're looking at what money do we have available, they could try ESSER 3. They can try all the ones that I said on this slide, and they can try the second round and third rounds of the ESSER funding, as we call it, those federal checks that we got. And so last thing I want to mention is the Safe and Healthy Students Federal Funding Guide. So if you go to the Arizona Department of Education's website and you look for Safe and Healthy, if you just type it into the search bar, on the side menu there's a link to the Safe and Healthy Students Federal Funding Guide. It takes a bunch of the things we're talking about today and breaks down how you can fund it in Title I, Title II, Title IV-A. It's a nice like crosswalk document. So happy to share that with all of you. So I know it's really short, and we don't have a whole lot of time, and I've been given the, like, you're almost done, but does anybody have any, like, quick questions on something that they might not understand about federal funding or local funding, state funding? Awesome. I'm going to throw my slide up here. that has that contact information. Feel free to take a picture of it or reach out to me. My information, if you Google, or like I said, if you go to the Arizona Department of Education website, you type my name in, my webpage will come up, all that fun stuff. So thank you guys so much for your time. I know it was really brief, but I'm happy to talk funding. I love talking about how we can get schools to spend money to support kids in ways that are really outside the box, which sadly, the things we do are outside the box in schools. So, let me know at any time. I'm happy to help. So thank you.
So Carrie, thanks for that. And sorry, folks, we called it kind of the speed dating approach to our presentations and panels today, so it is going to be quick. Hopefully, Carrie can stick around during our networking at the end, so if you have questions at that point or ideas for maybe bringing some funding, that's our chance, right? So next, I'd like to introduce Monica Huber and Elena Curley. So if you two wouldn't mind coming up. So Monica and Elena are from Tuba City Regional Healthcare. Monica serves as the health coach for the Childhood Obesity Intervention Program, Take Charge, and Elena is the Diabetes Prevention Coordinator, also from Tuba City Regional Health Center. So thank you all so much for being here. All right, and I'll give you the 5 minutes.
All right, good evening, everybody. I'm Monica Huber, and so what we're going to talk today about is the childhood obesity within our Tuba City service unit. So just to give an overview of what our Tuba City Regional Healthcare covers, it provides service to over 6,000 square miles area. We serve 8 areas or chapters within that service area. And the hospital serves approximately 100,000 individuals, and of that, 94 being Native Americans. That's a list of services that are provided by this clinic there as well. We fall in with that community health service there with our health promotion disease prevention program, which Elena will talk about here.
So good afternoon, everybody. My name is Elena Curley. I'm the Diabetes Prevention Coordinator for the Health Promotions Program. So under the Health Promotion Disease Prevention Program, we do have our best practice, which is our diabetes-related education. So our services that we do provide are our Take Charge program, which is geared toward our 9 to 12-year-olds. So I will talk a little bit more about that program as we go on. And then we also have our school-based activities. So we do a lot of things with our school districts. So we'll talk a little bit about that later on. And then lastly, we do have our community-based activities that we do, especially using some of the trends that you guys will be seeing a little bit later on that Monica will talk about. Right?
All right, so our childhood obesity trends showing here is a 13-year percentile in body mass index, and this is from all 11 schools. We do go there to conduct our fitnessgram assessments. Grades K through 12, so we have 2 high schools within that service unit, and the rest of them are elementaries, K through 8th. So looking at that, you can see that within our service area, over 50% of our students are falling within that overweight and our obesity trends there. And then again, just that percentile and BMI trend showing here over time from 2019 to 2020. And you can see that little dip right there between our healthy weight and our obesity going up, and that was right around the time that all of our students were at home learning. And so we did see a big increase in that there within our kids at the schools. And then here it gives a breakdown of all of our schools and which ones have the healthy weight. We also have schools where there is underweight, and a lot of those fall in our outlying areas where there is no grocery store. A lot of these kids are being bussed in from further areas and stuff as well, and then again showing those trends there. And it's broken down again from those schools, again, which ones are located within our Tuba City area, where they have that grocery store, they have that access to the fast food as well, which in this map here, it shows that by location. So you can see right in this area here in Tuba City, where they will have that access to that fast food, grocery stores, gas stations, compared to our school here in Denevito, which is located about 70 miles away from Tuba City, and then again, another 30 miles to a grocery store. So then we have all those that have that access to the fresh food and vegetables, again, have exercise opportunities. So our fitness center does provide a youth hour where the kids can come out and work out. Again, that's going to be for kids mostly in Tuba City rather than those outlying areas. Grocery store access, school environment versus the community environment as well. The time spent at school versus home. So with kids that do come to Tuba City, some of those are coming from those outlying areas. So they're getting on the bus at 6 o'clock in the morning, being bussed in, getting home until 5 o'clock again. So it's a lot of time at school as well. And then with our student-based activities, so with that data, what we do is we work with all of our 11 schools. We do have our school health team leader, so we do have someone located within each school that serves as a school health team leader. We communicate with that person to do our fitness gram assessments, any communication with health educations, because we do have schools, again, that don't even have health classes. They don't have PE classes as well. So what we do is we encourage our classroom movement breaks, is having those teachers have those breaks for their kids, whether it's recess or doing a 5-minute break and a lesson as well. And then we also have our biannual fitness gram assessment, and then having that building capacity for the staff and the families within those schools with our school health team leaders.
All right, so with that data, we also have our Take Charge program. So right now, we do have our childhood obesity intervention program, which is for eligible participants between the ages of 9 to 12 years old. It is referral-based, so we are working with our pediatric team at Tuba City Regional Healthcare. So when they do see that these kids are eligible for our program, so they have to be above the 85th percentile. What we're seeing more of now is a lot of our kids who are falling into that pre-diabetic range as well. So if they're hitting in between those two ranges, they're automatically eligible for our program. It is a 12-week course, so what we did is we took the CDC diabetes prevention program and we tailored it to our to our kids here. So we condensed it to a 12-week program. We noticed that the 16-week program is a little bit too long for a lot of our kids to attend, and especially because a lot of them do live out of town. So we condensed it to a 12-week program to where they're able to come in with their families, either a parent, grandparent, any caregiver that's at home who is there to help implement change within the household. We also implement our pre and post fitness gram assessment. So what we do in the schools, so pacer run, push-ups, flexibility. So these are some of the things that we do test and want to see improvements in a lot of our kids who come through our program. One of the things that's not listed here as well is our labs for the program. So we do require that our kids get labs done pre and post program. So we're able to see these changes within our program, and especially what's being done with the kids as well. So our lesson plans are culturally appropriate, so we do take that into consideration, as well as nutrition education. So again, making those changes within the homes, and also making sure that that parent who is there cooking meals there are able to make those changes, like change what kind of oil you cook with, what kind of groceries you're buying. We also hold many nutrition demonstrations within our facilities, but during COVID, we were unable to do that. But what we went ahead and did was we created little take-home bags. So I don't know if you guys can see that picture right up there, but that's one of the bags that we put together for our kids, and they're able to come by, pick it up, or we delivered it during COVID. And then the picture right up to the right there is one of our kids who prepared that snack with her family. So it was really cool to see that. Bottom picture here is some of the classes that we did pre-COVID, so we're hoping to get that started again since things are lifting back up again. We also have physical activity, which is one of the components that we do encourage for our Take Charge program. So getting at least 1 hour of physical activity every day. So we try to make it more family-based again, so making sure that there is a parent that's there to help encourage their kids to be physically active. Like Monica said, we do have our fitness center that's also open up to our participants. So we make sure that we go through our gym rotation with our participants and making sure that that's available to them as well. Through the program, we also teach teach life skills. So again, we want these kids to learn at an early age what they can do to continue being healthy adults. So we just keep reinforcing that they're going to be adults soon. So it's really good to learn at an early age, and especially with them cooking a lot of the meals that we do have within our program, it's more hands-on for them and easier for them to follow through. Our community-based programs, our activities, so we do have our Get Fit Challenge. So this is also opened up to our community participants, lifestyle balance participants, and our Take Charge. So with this program, I don't know if you guys can see the picture that's right in the middle here. That's from the 2023 PATS run. So a lot of our community members came out for that. We also had our Take Charge kids who were also a part of that as well. So it's more family-based again, making sure that we are getting everybody active. So it was a 10-week program to where they were able to come together with their families and also the community members and partake in these activities. So we had group runs, we had exercise classes as well, and we also had nutrition and physical education presentations as well. So that's really nice to have that again. We're also looking forward to another one later on this year. So we're hoping that we do get approval to do our our hot chocolate run later on this year. We also have our Summer Just Move It series. So this is going on right now. It's a 12-week program to help get our community moving, and especially our program participants. We also have our fall hiking series. So this used to be a summer event, but we moved it to fall again just to keep people moving throughout the year. Next up, we have our Community Health Improvement Planning, so also known as CHIP. So we do have another one of our coworkers who is working with this program, working with our local chapters to enforce some of the changes that they want to see within their communities. So a lot of those challenges are like pre-diabetes, drug abuse, and substance abuse. So these are some of the areas that they want to see that improvement. And also like safe walking programs for their communities as well. So these are some of the areas that we're trying to target within our communities that we do serve. Next up, we have our lifestyle balance classes, which is geared towards our adults 18 years and older. So these are our pre-diabetic individuals. So we do follow the CDC lesson plan. So these programs are starting back up now. So we're hoping to see more of our community members partaking in some of these programs. We also have our nutrition and physical activity education and demonstrations. So like Monica said, we do work with our school districts, and we're trying to get back into the schools to teach parents and students, ways that they can make, healthier snacks, healthier meals at home, and what's available to them, especially within the Tuba City service area. We also have our HBDP fitness classes for youth and adults. So we do have special hours for our youth participants to where they can come in to work out. We also have hours for our adults, but I think right now we're trying to get more hours for our youth participants, especially during the summertime. And then here,
all right, so here, these are just some of the collaborations that we have within our communities and families. So our partnerships, we do have administrator meetings, so we do go to the school districts, we do talk to the administrators, and then we also have our school health team leader meetings. So with each of those school health team leaders in the schools, we do meet with them monthly to see what kind of changes they are making in their school, what are they doing to encourage physical activity as well. And then we have our pediatric obesity task force meeting. That's geared towards that Take Charge program. We do have a pediatrician that we do work with in our hospital, and they are the ones who refer those kids to us as well. And then again, that CHIP planning meeting, so that way they know what kind of improvements those communities want to be making, and then collaboration meetings, especially for our big activities like our Just Move It, our hiking series, and things like that as well. And then this is just an approach to success. Like we heard before, it takes the whole community to make changes for a child. So here we have our individual, family, schools, community, and environment. So with all these programs that we do offer, we try to tie them all back in to everybody within this system here. And it just gives us a breakdown of the different things that we do within our programs for each of those components there. And any questions?
How does the community respond to that?
You've been there longer.
I think they're responding pretty well because we do get a lot of people who don't even know about our programs who want to be a part of it. So like with the Get Fit Challenge, that was more geared towards our program participants, but when we noticed that they wanted to be more involved with the community, so we ended up opening that up, back up to them. But we are seeing more involvement, especially like people are really looking at their grandkids. So we see a lot of the grandparents who are coming back from like our diabetes prevention program. So they're looking for ways that they can get their children involved, their grandchildren. So they see what our program is doing and the results that they're seeing. So it's really nice to see some of them coming back through again.
Do you still see a lot of problems with COVID as far as keeping people home or removed?
Yes, so that's one of the struggles that me and Monica do have. So a lot of parents are a little bit skittish about coming back into the fitness center because it is open to everybody. And right now, since we're lifting a lot of things with COVID, so we're not required to wear our face mask within the fitness center, but we still have kids and parents who don't want their kids around that. So that's some of the things that we're still dealing with. So we're still offering a lot of our programs virtually for those people.
Thank you.
All right.
Hopefully, Monica and Elena, you all will be available later as well. And it's just wonderful hearing examples of communities bringing resources in together to really help fill that void that schools aren't able to quite offer at this point. So next up, I'd like to bring Jessica Perfett up. And it's nice to meet you. Thanks for being here. So Jessica is the Child Fatality Review Program Manager from the Arizona Department of Health Services. She has over 10 years experience in public health, and thank you for being here. Appreciate it.
Thank you. All right, so my name is Jessica. I oversee our Child Fatality Review Program for the state. I know that sounds like a really scary name. I would name it something different if I could, but it's what it is. So I just want to talk about our program, kind of tell you what we are, what we do, who we are, who's impacted in our state, and then kind of give you a little bit more of a bright light, talk about like prevention and like what community and schools can do. So our program's been around for quite a long time. We've been around since legislation passed back in 1993 and reviews began in 1994. We started reviewing all of the child deaths in our state back in 2006. So since then we have quite a lot of information to know and empower people, which is what I'm hopefully going to do today, to let you know and bring awareness to what's going on. So our mission, in a very long way, is to prevent the child deaths that happen here in our state by doing in-depth reviews, multidisciplinary reviews at the local level. So we do have a team here in Coconino County. There's 10 review teams around the whole state. Coconino County is one of their own review teams that, we really dive in and do reviews at that community level, so we're able to see like what's happening in each community because it is a little bit different. And then we also do what's called second level reviews, but for consistency and quality and categorization, we look at all of our SUID, which are our sudden unexpected infant deaths, so those kids less than 1, and then we look at any like abuse or neglect related death at the state level. We also have a state team who meets right before our annual report is released on November 15th every year, and they vote on which prevention recommendations make it into our report. So like I said, we have 10 local review teams. Coconino's its own. I have a nice little map that's kind of color coordinated. It'll show you the different review teams around the state. The same color means the same review team. So we do publish a report that's statute required. It's due to our governor every year, November 15th, and we just produced the 29th. We're working on the 30th one this year. That is very long. There's over 120 pages in there. It's a lot of data. I could talk all day if I needed to, but let's not. It's too much information, and this is speed dating. But it talks about all of the data surrounding what we see, any prevalent risk factors, any of the disparities, any prevention recommendations. All of that information is in there. We also create what's called infographics and county level reports. So if you're looking what's happening specific in a county, you can pull up these, or if you want to know like what's specific by a different cause or manner of death, you can use these. And these are great like education tools to help bring awareness. So I will dive into, these are all the deaths that happened in 2021. I'm just going to give you a little high level just to bring awareness of what's going on in our state. And again, this is specific to 2021. So we had a total in our state, this includes residents of Arizona, but also anyone traveling through. It's a death that happened in our state, whether they're a resident or not. We had 863 of them in 2021. About half of them are preventable. We had 48% of them. And then infants are about half of our deaths that happen in our state. For abuse neglect related ones, we had about 15% of all of our deaths were related to abuse and neglect. You can see our mortality rate. This is over 10 years, back from 2012 up till 2021. It's remained kind of up or down, but we did see quite a big drop in 2019, and then since kind of the pandemic has hit, it's been on the rise. We do categorize according to the 5 manners of death, which is in alignment with the medical examiner's office. So there's natural causes, accidents, homicides, suicides, and undetermined. Our natural deaths, which most are not preventable, makes up the bulk of our deaths that we see here in our state at 59%, followed by accidents, 28%, homicides, suicides, 5%, and then we have an undetermined category. In terms of disparity, this little bar chart is going to show you that in that kind of darker purple color, that's the percentage of fatalities that happen or the deaths that happen in our state versus the population. So you can see right offhand our American Indian and our Black children are disproportionately affected in Arizona. Our American Indian children make up 8% of the deaths that happen here, but they're only 5% of our population. Same as our Black, they're 15% of our deaths, but only 6% of our population. Overall, our top 5 leading causes of death was prematurity, congenital anomalies, motor vehicle crashes, firearm injuries, and suffocation. We saw substance use involved in every 1 out of 5 deaths. We saw for abuse neglect, 75% of those were less than the age of 5, and 95% of our suicides occurred in an unsafe sleep environment. This busy slide, so this kind of breaks up the leading causes of death by age group. So on the very bottom, you'll see the top 5 leading causes of all deaths that I talked about. On the left, it'll break it up by the different age groups. So our 0 to 27 days are most affected by prematurity. Our 28 day to 1 year post-neonates are affected by suffocation deaths. Our 1 to 4-year-olds drownings, our 5 to 14-year-olds motor vehicle crashes, and then our 15 to 17-year-olds by firearm injury. So let's talk about preventable deaths, because this is where the action can happen. So we determine a death to be preventable if a community or an individual could have done something that would have altered the situation surrounding that child's death. So we had almost half, 48% of all of our child deaths were preventable. 50% of them are not. Those are natural causes. And we had 2% that are, we just weren't able to determine. Either there was a lack of records or we just weren't sure if we were able to prevent them or not. So our top 5 causes, this is not all deaths, this is top 5 of preventable deaths. The leading one was motor vehicle crashes, followed by firearm injuries, suffocation, poisoning, and drownings. So I'll jump into the percentage that we determined to be preventable. Again, this is determined by our review teams based on all of the information that we gathered and captured during that review. So we determined 100% of our accidents, suicides, and homicides can be prevented. Only 12% of our naturals can, and 87% of our undetermineds. So I'm only going to jump into the cause of death for motor vehicle crashes because I don't have time to go over everything. Since that was our leading cause of preventable death, I'm just going to give an example of what is in our annual report, which is broken down by all of the different causes of death. So for example, our motor vehicle crashes, we had 72 of them in 2021. That represented 8% of all of the deaths in our state. It was a 21% decrease from the year prior, 2020. 100% of them, again, preventable. The ages that were most affected are that 15 to 17 year of age range. We kind of saw almost even with, in terms of gender, 58% male by 42% female. And then for disproportions, we saw our American Indian children and Black children that were disproportionately affected. So our American Indian children were 23%. Again, they're 5% of our population, followed by our Black children who are 20%, but only 6% of our population. And then we did see 40% of our motor vehicle crashes involved substance use. So looking at the age range of motor vehicle crashes, the bulk of them were that 15 to 17 year of age, followed by our 10 to 14-year-olds at 24%, our 5 to 9-year-olds at 17%, and 0 to 4 at 13%. a lot of people ask, like, what was the position, like, what seat was the child in? Were they a pedestrian? Were they a driver or passenger? So most of our children in motor vehicle crashes are passengers, which make up 64%, followed by the driver at 22 and pedestrian at 14. So one of the things that we do too around each of the cases, we're not only looking at all of the data surrounding like numbers, we also dive really deep into what we call preventable risk factors, but we look at the situations surrounding each of the different causes of death so that we're able to see what we can do to help prevent these deaths. So for motor vehicles, these were the leading risk factors that we captured for any motor vehicle crash we saw here in the state, and the number one leading risk factor was a lack of a seat restraint. That could be a lack of a seatbelt or lack of a car seat, including improperly used car seats. That was 56% of all the deaths were due to a lack of a seat restraint, followed by reckless driving, substance use, excessive speed, criminal activity. CPS means Child Protective Services. That's with the family, so it may not have been a case with the child themselves. It could have been something going on with the family as well. But 25% of the kids had some history with CPS, and then inexperienced driver at 14%. And I do want to point out, too, there could be more than one of these risk factors that were involved in a case. Okay, so that's enough of the data, but I wanted to show you the prevention recommendations that we have. The ones that I'm going to point out, we have pages and pages of prevention recommendations as to what we can do as a community, but I'm going to point out the ones that were based on the increases that we saw from 2020 to the 2021s. So for abuse neglect, that increased a lot from 2020 to 2021. So some prevention recommendations include the expansion of our DCS, or Department of Child Safety Workforce Resilience Program, increasing home visitation programs, and awareness and support of the All Babies Cry program. For drowning, prevention recommendations are increasing public awareness of the dangers of drowning, caregivers never leaving kids unattended near any kind of open body of water or pool, proper pool enclosures, four-sided self-closing gate, teaching children the ability to swim, so swim lessons. For firearm injuries, prevention recommendations include removing firearms from households with children, especially any that have prior warning signs or prior attempts. Proper storage, which includes keeping the firearm unloaded and locked in a safe with the ammunition stored separately, and then interventions to prevent firearms violence among children in school. And then for prematurity, that was our leading cause for our neonates. Prevention recommendations were avoiding using substances such as drugs or alcohol during pregnancy, because that increased the risk of preterm birth and other complications, encouraging regular prenatal care, increasing the availability of affordable health insurance, increasing the awareness of accesses coverage postpartum. It's up to 1 year now, and again, increasing home visitation programs. For substance use, recommendations include training professionals in trauma-informed care to better address ACEs, or adverse childhood experiences, improve access to personalized substance use disorder treatment plans, especially in our rural areas, expand access to services for people experiencing either homelessness or unstable housing, and increasing the availability of naloxone. And then our last one up surrounding our sewage prevention recommendations are using educating parents and caregivers on safe sleep environments and using real-life testimonials in safe sleep educations, talking about the ABCs of safe sleep, so alone on their back in a crib. They should always be placed on their back to sleep with nothing in the sleep environment, a flat, firm, non-inclined surface, until a baby's at least a year of age. And then also like increasing room sharing, not bed sharing, so always keeping the baby on a separate sleeping surface. And again, increasing home visitation programs for our infants from birth up to 1 year. So these are just a few of our recommendations that we point out, but there's a lot of work that can be done at the school level, community level, individual level. It just depends on what's going on and what we see. So the purpose of our program is just to bring the awareness to the community, to know what's going on and what we're seeing. That way we all can work together, because it takes a whole community and an army to do prevention work and to help save the health of our Arizona children. But that's it. If you have any questions, feel free to reach out.
That was fantastic. I don't know if the wheels are spinning there. We're starting to see this theme of the need for community involvement, taking a family and getting families involved with kids in schools, but also community agencies and the tremendous impact those agencies can have on the health of our kids. So anyhow, that was fantastic. Thanks to you, the speakers, for really sharing the challenge with really Kids Help. With Kids Help, it is wide-ranging, many of the challenges that we have to address. So I do want to mention, because we're doing this speed dating data, kind of approach here, feel free to be rude, go grab a drink while we're speaking, and we've got our panelists up here. But at this point, we're going to shift into our panelists. And let's see, we've got our is it nutrition first? Yeah. Our nutrition panel first. So I'd like to introduce and welcome Barbara Ann Hirkins. And Barbara Ann, you're going to have to correct my pronunciation on this one if I got it wrong. Taryn Kunkel, and then also Teresa Kolpinski, if you three would mind coming up and joining the panel. Barbara Ann is a registered dietitian, and she's currently working with Northern Arizona Health. Taryn is the Flagstaff Unified School District Food Services Director. And then Teresa Kolpinski is the Program Manager for Coconino County Health and Human Services. So, we'll just start off, if each of you could just take, maybe 5 minutes or so introducing yourselves, and then and kind of what you do and your angle here, and then we'll dive right into some really tough questions. All right. And I think, do they have to push a button?
Hi, my name is Barbara Ann. I was born and raised in Flagstaff. I started off as a biology teacher. I then specialized in anatomy and physiology. Teaching kids about anatomy and physiology, I really saw that their learning of how their bodies worked increased their value of their bodies, and that really encouraged me to go back to school for my master's of public health. I am very interested in eating disorders. I am a health at every size clinician, and just really excited to share that information today.
Hi everyone, my name is Taryn Kunkel. I'm the food service director with FUSD. I've been in child nutrition since I graduated from college, so close to 10 years almost at this point. I started my career in Sedona. I was the school food service director there, excuse me. And then I moved over to ADE, and I was on the auditing side for the school nutrition programs throughout the state. So quite a few of the schools that were mentioned in the Tuba City presentation I've been to, so it was kind of fun to see those pictures and see the school sites. But I love being in Flagstaff. I'm from California originally. My duty here is to run the day-to-day operations of the food service program within FUSD, and we serve about 8,700 students, and we have 16 school sites.
And good afternoon. My name's Teresa Kolpinski. I'm program manager with Coconino County Health and Human Services, and I got here in Flagstaff in an interesting way. Went to school to be a physical education teacher, yay Carrie, because I just loved being active, right? Didn't even know about public health. So when I moved to Flagstaff 32 years ago, got a job with Killip Elementary in Sonawa, teaching and coaching, loved life, had kids, stayed home, started childcare, and then it's like, all right, time to go back into the working world. I was sort of tired of wearing PE clothes, so I'm like, let's go work for the city of Flagstaff. So then I worked with Parks and Rec there, running their adult and youth leagues. Just loved meeting the people, collaborating, providing that activity and options for our families. And then a position opened with County Health 20 years ago as a public health educator. I'm like, great, I love teaching, back in the classroom, teaching nutrition, physical activity. And then I was fortunate enough to become granted the program manager position 10 years ago for our grant-funded program through the USDA called AZ Health Zone. And I also oversee the Quality First program. So I took when we have interns all the time from NAU, took my physical education career and just turned it upside down in every facet. And had I known there was a public health venture when I was in high school, I would have gone right to public health. So I'm glad to be here. Thank you.
Fantastic. Well, thank you all for being here. And we're going to just dive right into some questions. For those of you online, if you have questions you'd like to pose to the panel, feel free to just put them in the chat. We have somebody monitoring the chat as well. But we're going to just go through some tough questions for this crew. And we're just going to start with, what is the big deal with nutrition and kids when it comes to success in schools? What's the big deal? I don't know, who wants to start that one?
I can go ahead and start. I think I'll be the starter, I guess. I think when we think about nutrition, everyone in this room knows that before we kind of nitpick at what someone is eating, we have to make sure that they have access first. We need to make sure that kids are eating, and I don't see that in the schools. I don't see that in the hospital. I think a lot of students, especially secondary students, are skipping breakfast and lunch, and then they go home and they are starving and they're eating a lot of food. They're not being mindful about what they're eating. They're not taught how to be mindful. They're not taught to have eating competence at all, and that can really lead to weight cycling and weight stigma. And that can also contribute to eating disorders later on in life. And so we know that the number one risk factor for an eating disorder is dieting before the age of 14.
And I think the opportunity to have access to nutritious foods does diminish behavioral and mental health issues within students and absenteeism as well. So that's kind of where I come in, I guess, with the school nutrition program. But I do notice, like Barbara Ann mentioned, especially at the secondary level, there are quite a few students that do not eat breakfast or lunch. So I think today we're just trying to figure out where to go from here. And I think COVID did affect quite a few things just because kids were at home and there was no structure throughout the day necessarily. So I'm not exactly sure what FUSD looked like pre-COVID. I've been here for about 2 years now, but I have noticed some concerning things within the schools. I have talked to teachers at various elementary schools as well, and you would be surprised how many students are on diets and that type of thing. So just providing education around nutrition. I don't know if that's necessarily happening right now, but at least the students have access to fresh fruits, vegetables. We also serve Loop Elementary, which is about 50 minutes away from here. So it is kind of a food desert as well. There is no grocery store close by. There's a gas station, but that's about it. So just making sure that there's access and the kids are more likely to come to school and enjoy their academics. So.
Mm-hmm. Yeah, and with AZ Health Zone, that's one of the wonderful things about this program is that we try to work with the whole community. And we do that in ways where we work with the school districts to help them update their local wellness policies to meet USDA standards so that they're having access to the fresh fruits and vegetables, trying to nudge the students to eat, right? Because they serve beautiful, healthy meals and the kids not necessarily have to eat them, right? So that's one of the struggles, definitely. We work with the community, like healthy store retails, right? So we talk about food deserts, especially in Coconino County being so vast. So we're trying to work with the schools to have access to a salad bar at every lunch and meeting those standards. And then we work with our, like Bosch's in Tuba City to improve the items that they're selling, right? When we first started the program, you had one option for whole grain bread. You had not very many options for no salt canned vegetables. There were no non-fat or big containers of Greek yogurt, right? So trying to get more items available to choose from has been beneficial. We were able to get individual priced fruit at the checkout stand and at the deli, just trying to incentivize, right, folks that are purchasing items to choose that healthier item. Because then that correlates to what the students are eating at home also. So we're feeding them healthy meals that meet standards in school, but what are they eating at home also? So trying to get that consistent message, right, from all of us, and all of our community members too, organizations that are trying to have this consistent message through nutrition.
And absolutely, and eventually I'd love to hear more about the nutrition education standpoint, because we heard even from our folks from Tuba City about, hey, look, here's a curriculum, and I know, so hopefully you get a chance to share some of that here shortly. But so there are challenges, right? How do we get the kids to make the right decisions when they have opportunities there? So, for example, they're eating Takis, right? Here's these Takis, and I remember at our last wellness meeting, it was...
Conversations about Takis.
Yeah, of course, because the kids love them, you know it, and they lead to ulcers and all kinds of other things. But there's that. We're restricting foods in the classroom in the school. We have guidelines, right? But then even we heard, hey, here's the fundraising. This is the mixed message that we're seeing from schools. Hey, eat healthy. It's kind of like in our PE world, we say, hey, don't use exercise as punishment. Hey, you're in trouble, go run a lap. Activity's good. So it's the same thing with really food. But, we have guidelines for what is to be offered. Can you talk about some of, whether it's for fundraising, whether it's for school celebrations, whether it's for what we offer from those school meals, right? Can you talk about why some of these guidelines are in place? And then what are those challenges you're seeing with enforcing those guidelines? And then how can we address those?
I can talk about enforcing.
So with the guidelines, you try to, there's USDA guidelines, there's Arizona Department of Ed guidelines, and in order to get reimbursed for meals, you have to meet the guidelines, right? So now that we have a recess law guideline in schools that every child, kindergarten through 5th grade, must have 2 recesses a day. A lot of our schools don't know that, so things get filtered partially, maybe to upper administration and not down to the staff. And then with fundraising, we have smart snacks now. So they have to meet certain guidelines to serve or fundraise, serve food during the school day that meets those guidelines. And the school day goes from 12 a.m. in the morning until half an hour after the end of school. So like our evening activities don't need to follow the guidelines.
I think so there's a wellness policy that every school district within the state that's on the National School Lunch Program, they need to have a policy in place. So it's supposed to outline objectives for nutrition education or physical activity or other school-based programs or promotions. But of course, we are understaffed constantly, and after COVID, everyone's short-staffed. Principals, they have a lot on their plates too, so just disseminating the information that they know, like, hey, you're not supposed to bring cupcakes in during lunch to celebrate a birthday, like, save it for the end of the day. Like, all of these things are almost impossible, it feels like sometimes, to control just because there might be a sub in the class who has no idea what's going on, and it's just, there's a bunch of misinformation out there. So I love the idea of the wellness policy and having these great objectives and goals that you want to meet, but the enforcing is definitely more of a community effort, at least in the school district. And now it's just trying to figure out, like, how do we actually promote the wellness policy and promote whether it's nutrition education or physical activity, how do we promote it and how do we educate our leaders in the schools?
Yeah.
So one of the things we do at community events is to survey the participants, the families that come in, and I ask them, okay, are you aware that there's a local wellness policy? And 90% of the time they are not aware. And then try to get that interest to participate on the committee or to be proactive with the policies and the choices that they bring. And promoting the school lunches also in the breakfasts. Because they're 3/4 of the meals for the kids the day, right? So they go home and get dinner, but they're getting most of their nutritional value at school. So we want to make sure that they're eating. So trying to nudge them to eat again, like cutting up apples during lunch will help them eat an apple instead of handing them a whole apple, right? But sometimes that's time consuming. Some of our classrooms get breakfast in the classroom, right? So that influences and encourages them to eat with their friends for breakfast instead of coming to school hungry, because we know that a hungry child doesn't learn as well as a child who is nourished. So all those little tactics.
And then back to Takis. So I feel like trying to reach out to parents and adults as well, because it kind of starts at the home, right? We can do so much in the school setting, but we can't be there day in and day out, night after night with students or children. So just trying to figure out how do we educate parents that may not have got the education when they were in school, because I don't remember having nutrition education at all until I was in college and I chose to go that route. So we've had quite a few conversations about this, and if anyone has any ideas, feel free to see us after. But yeah, I think that's kind of our main focus right now, is trying to start it as a community at the parent level, and then, I mean,
who doesn't need more nutrition education, so.
Right. So for example, we were in Grand Canyon schools yesterday, and we were like, oh, we're bringing pudding, right? But it was avocados and cocoa, unsweetened cocoa, it was unsweetened milk, and coconut milk, and a little bit of honey, right? So at first the students are like, oh, we're having pudding, yes. And they want that sweetness. So when they taste it, they were like, oh, this is different. But our 5th grade class, we didn't tell them what was in it, because the 9th graders made it for them, and we just gave it to them. And they were like, oh, this is good. And then we're like, what do you taste? Oh, we taste chocolate, of course. And once they found out it was avocado, it was interesting how their reactions changed. Oh, maybe I don't like this, right? Even though they loved it, they love guacamole, right? So we talked about that conversation. So it's wonderful to be able to educate the students, have the food demos like Tuba City does, which is beautiful. But again, there's only, I've got one staff in Page, half staff in Page, one staff in Tuba City, and one staff here to cover Grand Canyon, Williams, and Loop, right? So it's difficult to get into every classroom. So that's where we try working with our community organizations, right, to promote the nutrition education part.
Yeah, and I think, thinking from a regulation standpoint and a standpoint of enforcing, I think the main thing I learned as a teacher is that you can't force a kid to do anything. You don't enforce a kid, you don't force children. You really have to give them the skills and set up the environment for them to learn. And the role of the school system, the role of us as adults in supporting kids in health is to set them up for the real world. And they're going to be exposed to unhealthy foods in the real world, along with the healthy foods. And so to me, it's not necessarily about restricting those unhealthy foods in schools because, well, we can't really do that anyway. It's about how do we set up reasonable situations. Food is celebration is a part of food, right, and vice versa. And so can we make it a fun activity where, kids are learning about contextual skills, they're learning about what they like and dislike. If a family member wants to bring in cupcakes, well, can we have kids blindfold each other and taste the cupcakes and really think about that sweetness and think about their body cues and when they're hungry and when they're going to stop eating? Because those are the skills that are going to be preventative against health issues, and those are the skills that are going to be real in setting them up for success in their lives. Of course, we want there to be an easy answer here, but I think that it is a confusing field, nutrition, and there's either people that are really, really healthy and perhaps over-dieting and over-restricting and don't want sugar and don't want these preservatives. And on the other side, there's people that just don't have the knowledge and the access, and we really have to, I think, come together as a community and be really clear with our communication of moderation and balance and what that looks like, and the school system can do that for families at home.
I like to bring up the elephant in the room, and that's the politics. I see the political situation in our government. How much are you guys working with them, and how much are they either preventing or all that controversy in the back and the forth? That because I don't see any political leaders here, but you guys are talking about community. Where does the political situation fit into all this? I think things would be so much easier for you all, for everybody, if there was less controversy there. And I'm looking for an easy answer, or just to bring it out, because it's stunning what's not being done at that level, and what everybody, so far, what I'm hearing. These are all really practical, common sense kinds of things that we should be doing. Where is the political support? And if you guys would even just comment on that.
I think the thing that comes to my mind is that it's about money, right? And where we put our money. And we know that the lack of health literacy in this country costs us trillions and trillions of dollars. And there are, several people in hospitals that have illnesses and suffering that is completely preventable, but we will not fund for education in health and nutrition and, these preventable things when we're kind of paying a lot more on the back end. And to me, I think that communicating that and just doing really good, authentic research where confounding variables are controlled so that we can show and prove to political leaders that, these these preventable programs work. I think that's what our job is to do today and, in our individual work.
I also think it's partially about buy-in. So, like, we can talk all day up here, but if we don't have the concrete data to back up what we're talking about, there's no change that can be made. So I know, like, a couple months ago, Food Service sent out like a staff wellness survey, for example, because there was no data at all on like how teachers and admin in the school buildings saw their students or like what they heard their students talking about. So I think that for me was like, Barbara Ann used to work with me, but that was like our first step to like send that out to actually get concrete data back to figure out, okay, so this is what we see, now where do we go from here? So again, it's all about buy-in and like, why am I gonna put my money that I don't really have because they're not funding education in Arizona, at least not enough. Why would I put my money into, providing like a full-time nutrition education teacher or, any, like whatever it is, there has to be buy-in and we need the data, which we don't have.
So that other lady that just presented all that data, that was a lot of data.
That was a lot of data, yeah.
Right.
Yeah.
Sorry, I just lost my train of thought. I was going to mention that, so one time I went into Safeway, and we used to do tours, grocery tours with the third graders. And I went into Safeway, and it was before the beginning of the school year, and of course you walk in, you see 2 for $4 energy drinks, and you see Takis, and so you see the unhealthy choices when you walk into the store. And I spoke with the store manager, and I said, I introduced myself and what our role is in the community, and he's like, yeah, well, I'm here to make, run a business, I need to make money, right? So again, it goes to that all of us as a community need to be on the same page and have the same goals, right? So it's like, well, at least put them in the back of the store, so maybe they'll grab an apple on the way through the fruits, right? The access, how easy is the access? Even with our food banks, we work with them to make it more of a pleasant experience for shopping at a food bank, right? And sometimes our food banks are trying to work with them to not have all the sweets, because that's what's left over and the preservatives are in, so it's available, right? So trying to provide all the healthy choices there. But that's where the local wellness policy comes in, which is a start for our schools, because it does cover all the health, all the aspects, the nutrition, the physical activity, the mental, the staff wellness, right? If our staff aren't well, how are our kids going to be well that are in their classroom, right? So we can start with our schools, right? And build that community, and having good leadership at our schools promoting wellness will create this wonderful section of our community that's healthy. And then from there, hopefully those messages, we need to figure out how to get them home, right, to the parents and to the families, and sort of work our way from the bottom. It seems like where we're at right now. But I love that idea of working from the top down in this situation.
Yeah, in a perfect world, that'd be awesome. But it also starts with showing up too. So like we are all on our wellness committee. And Steve is too, but there's maybe 8 people at the most in the room that show up, I would say. So again, if people aren't showing up and talking and having discussions, then why would anyone want to make a change? Because it doesn't seem like it's a community need. So I don't know what everyone's, duty is or what you do for a living or, what brought you here, but feel free to come if you want the information. I can take your email down, but we're always, even if you don't have kids, like we're just looking for community partners and just people in the community to show up and have conversations with us. So everyone's more than welcome.
And as you mentioned, there are wellness policies for every school district. So even if you're not in this area, there are going to be opportunities wherever you live. But, that's kind of getting towards the communication side of things. I mean, there are a couple things here. Number one is the education, the funding. We don't have the funding for health educators really at schools, let alone somebody really doing well with nutrition. I mean, we can't even fund physical education in a lot of schools. So that's one challenge. So then that's where there is that void. You've got folks, I know the county does a lot with nutrition education in the schools. We're seeing it from Tuba City Regional. So that's one challenge. But the other challenge along with that is then communicating to the parents. What are strategies or what do you see as things that are actually working or as far as communicating to the parents, like, hey, look, here's a healthier meal. So communicating the kids really through education and then communicating to parents. I don't know if anybody wants to talk about that wide open question.
I can talk a little bit about that. So I did that work at the school district with Taryn, and then I also do that at FMC. So we have the pediatric floors, and then we also have a program that specifically aims at working with families to encourage the health of their children. And I think the number one thing is, you know, if your child is in the hospital, or if you, in a way, get called out by a teacher that notices something about your child, that's really hard, especially if you don't have the education, if you don't have the knowledge, if you don't have the support. And so, you know, we always want to be aware that attacking someone verbally or making them feel bad is never going to solve the issue. We really want to provide them with skills that really work and that are reasonable for them. And so a lot of it is a lot more about just listening to, you know, the barriers that they have in feeding their children. One of the things I communicate a lot is the Seder eating competence model. Is anybody familiar with that in here? Okay. It's a division of responsibility, and so it really helps the parent kind of see, okay, you know, my job is to provide exposure to healthy foods or unhealthy foods to my child in a controlled setting without distraction. I'm going to choose when they eat, what they eat, and where they eat, and then the child's going to decide whether or not they eat. Because we know that forcing children to eat things is not good. We know that that leads to disordered eating. You know, it teaches children to listen to their body cues. It teaches kids competency, right? Even getting children involved with the cooking process. I was really lucky to teach at the Museum of Northern Arizona for the last couple of years, and you know, was able to bring these kids out into the garden and to plant seeds with them, and then come back a couple months later and pick the vegetables and cut up the vegetables. And man, kids will eat vegetables if they grew them. And so what does that actually mean? Like, those are things that work. And it's not targeting their BMI or their weight. It's not targeting these things that, you know, perhaps aren't the etiology or the root cause. The root cause is those skills that are going to help them be healthy in the future. And so eating competence model is something that I communicate a lot, and I have found it very helpful for families.
We're finding that a lot of families don't have the skills, and even individuals, even our 25 to 35-year-olds, right? And now we can just buy meals and throw them together. So we're trying to create, well, we have recipes, but however, it's like, where do you find recipes? Or a QR code, right? To make it easy to, instead of a piece of paper, trying to do QR codes. We have adult education classes for cooking, and it also adds mindfulness to it so that they can learn those skills. We worked with some schools where it's a parent and preschooler, so they come and cook together, right? To not have that kitchen experience be so scary for a parent to allow their child to come cook, because that's where they're learning and they're observing. But it really is a lot about time too, right? Like, we're so busy and we're so tired when we come home. So how can, again, have that work-life balance where we can go home after work, after a long day, and actually just sit down and enjoy that meal together to enhance that experience, right, as a family. And even if it's breakfast, because we try to say, if you can get one meal together as a family, that'll promote talking, right, with your family together, and eating the food that you're making. But it could be breakfast, it could be dinner, right? Dinner's kind of hard without everybody running around with their activities. But just trying to find those little ways that we can include everybody in the family in the cooking process. And that's where some of our education classes promote that. And then we always have a take-home to the parents, but how many parents read what is taken home, right? It's shoved in the backpack. So again, trying to find those other ways to communicate with our families. And we try to do that again at bashes. We do food demos, right? So a child who had one of our health educators in their classroom be like, oh, hi, we taste tested this in school. Let's go buy this, Mom and Dad, at this shopping center, right? And then they see us there in the store using that same ingredient, or using a different ingredient. So sparking interest and excitement in trying new foods, and taking that time to cook again, right? Yeah.
I'm curious, just
Wait, hold on just a second. Let me ask one question online first, and then we'll come around to some other questions here, folks. And for those of you in the room, when you ask a question, we're going to bring a mic over to you so the folks online can hear. But we've got one question online, which does relate to something we talked about earlier, but, you know, oh gosh, where did it go? This is from online, let's see. What do you think about the USDA's proposed changes to the school menu standards, school meals standards? Are they enough to be effective in addressing the nutritional needs of students?
I think so. They were supposed to take place before COVID, but that kind of halted everything. So it's going back to what it should have been all along. So the sodium requirements are changing drastically very soon. And then the whole grain requirements sort of went and took like a back seat during COVID as well. I never changed my menu planning for that. I think it depends on the person that's planning the menu, but I don't really see the point in going back to non-whole grain items when you're eventually knowing you're gonna have to like go back to whole grain 100%. So I look forward to them. I do think there have been some great things that I've seen. I think the vegetable subgroups are amazing. They're not going anywhere, but it does make sure that students are offered 5 different subgroups throughout the course of a week. So you're exposing them to different nutrients. I think, it's definitely not gonna hurt. Let's just put it that way.
Yeah, I think one of the things, is this on? Sorry. I think one of the things I'd like to see is just some type of regulation or consideration about added sugar. Of course, I'm all about balance, but our kids, especially when they're young, they're developing their taste buds. And so if they're exposed to very, very sugary foods, that's kind of their sweet limit. And so, I think it is important for schools to set up balanced meals without all that added sugar. I think there's a lot of limitations I saw with working with Taryn and just food suppliers, that our industries, our food industries do make a lot of money by putting salt and sugar in foods. It makes it cheaper. And so we really have to change that on several levels before we change it in the schools. That is something I really hope to see. And then I also wanted to just talk a little bit about magnesium. So we know that magnesium deficiency has been linked to a bunch of anxiety and depression disorders, and of course linked, I'm just talking about a contributing factor. And a lot of those vegetable subgroups, a lot of those whole grains that we have at the school system, that it contains great concentrations of magnesium. And so it's so important that kids get those and get exposed to those varieties of fruits and vegetables.
Yeah, I will say, he brought up breakfast. So I do think it is interesting that the USDA considers like just cereal with like a graham cracker to be a complete breakfast. Granted, they have to take a half cup of fruit. But personally, like if I don't have protein in the morning, I'm hungry like an hour later. So again, I think it's up to the menu planner and then where you want to take it in your program. So we worked with Teresa. She came in and observed like our breakfast in the classroom school, and then we altered the menu to include less whole grain added sugar items, and it actually did not affect the participation at all. So I think that's something we're going to work on probably next school year as well. It's just, I don't know why muffins are considered a complete breakfast, but I don't agree with that. I think there should be added protein, whether it's like a string cheese stick or scrambled eggs with whole wheat toast or whatever it is, but the breakfast model is a little bit wonky to me, so.
And then I just want to add one thing too, that like chocolate milk is non-fat, right? So we want to provide kids with options, because sometimes you have to weigh, if you're looking at, and this was a change for me, right, the trauma-informed approach, but if you're looking at chocolate milk versus white milk, if a child is not offered chocolate milk and they don't take white milk, where is their calcium coming from? So they're building strong bones, right, up to age 18. So sometimes we have to sit back and look at, okay, so if they're only going to drink chocolate, then at least they're getting the calcium out of that. But the thing that's not known is that the milk served at school is a way lower concentration of sugar than at the store. It's so different, and no one realizes that. But in appearances, right, perceived, we see, oh, school's serving chocolate milk, it must be good for me, so I'm gonna go buy some chocolate milk, but it's at a different sugar level, right? Yeah. So, and we know that if we just start with white milk and not even introduce chocolate milk, then they won't even know the difference, right? So there's a balance there that we're working with.
Yeah.
Just that article about the USDA saying, oh, no more chocolate milk in schools, but I'm curious to see where that one goes, but that's for another day. I loved the chocolate milk when I was teaching. That was my favorite thing. Anyhow, so we had some questions here, so we'll go here and then.
Mine's a simple question. I'm just curious, how many families eat together anymore? Have you noticed that?
Less for teenagers.
We don't really see it in the schools much just because COVID. So the parents come occasionally, but not like they used to.
And it's different in each community. Like we're seeing that families eat more together in our rural communities than in, if you call Flagstaff urban, right? Because of access, right, and opportunity. Yeah. Good question.
First, I just want to thank each of you for being here, and I really love your enthusiasm around this topic. It's wonderful, and admittedly, I am a parent of a kiddo with celiac disease, so my question is about how do we ensure access to safe foods for kiddos with food allergies, and even just thinking beyond the school as well. It's expensive to have a kid with food allergies. What if a family doesn't have the money? What if they go to the food bank? How do we ensure, what if that's where their primary source of food is? How do we ensure they have that food, and then that there's enough of that type of food, even if it's fresh fruits and vegetables for them? So thank you.
I can talk about the school setting. So we do provide special dietary accommodations to students with restrictions, so celiacs would definitely qualify. So you just have to fill out the paperwork and get it signed by a licensed healthcare professional, and then we would make the accommodation. So that is one of the nice things USDA did put into place. So no matter the cost, we pretty much have to follow the guidelines. So if we get the submitted documentation, we have to react and create a separate menu specifically for a student with a dietary restriction.
So we have a 504 plan for our kids.
Oh, okay.
We've never we've never requested that because we don't have any information around how the food is prepared.
Yep.
What's the cross-contamination, the chances of that and so forth. So we've just always packed the lunches.
I don't blame you. Our kitchen managers are trained annually on food allergies and cross-contamination. So at least for me, like if I received that across my desk, I'd specifically go to that school and educate the staff members in that kitchen. We have seen quite a few interesting special diets this year that I did not see last year, which has resulted in more training, but so far so good. So if you're brave enough to try it out, just email me and we can definitely get that started for you.
Yeah, and if I can answer or go into that a little bit more as well, I totally understand how scary that is to not know what's happening and to kind of send your child out and get food from a place that's uncontrolled and you're not quite sure, what's happening. I think the regulation at the school system, at least FUSD, is really, really good. So we think about these big systems, but it really is working with that kitchen manager. When I was at the school system, even had parents just come and meet the kitchen manager, or we also will plan a menu and have the parent approve it. There's also just if we understand food safety and cross-contamination, there's a couple things that we can do to reduce the contamination to 99%, making sure that you're cooking that special food first so nothing else is touching those surfaces, and changing gloves, and really basic things like that can really help prevent anything from happening.
My question is specifically to you, Taryn, and I'm Jamie Smith. I'm the school counselor at Dave Miguel Elementary. And you talked about the chocolate milk versus the white milk. And this has been an issue that I have had at our school because I have watched umpteen million full cartons of milk be thrown in the garbage because our school will not serve chocolate milk. And my argument has been at least exactly what you said, at least they're drinking milk and getting the calcium. So I want to ask, is there any discussion about who can ultimately make that decision? I mean, why is that the decision of the school administrator?
Yep. Like I said, I've been here for 2 years. So when I got here, it was like getting out of COVID and kids had just gotten back to school. So that's a battle that we probably need to address, just because we did the food waste challenge at your school last year. Very interesting to see how much milk was thrown away. Yeah, so one thing I did, I was at Kinsey, their principal told me parents were kind of up in arms about chocolate milk. Then students presented to the faculty about it and researched it, and then they changed their mind. So I don't know, I mean, that could be a fun activity for kids to get involved with if they're passionate about like wanting chocolate milk at their campus. But yeah, I mean, I can definitely push for it. I have a couple of interns this summer, and I don't have a whole lot going on with them because school will be out. So we can put together presentations.
So is that district-wide, that it's administration's decision? I mean, the principal's decision. Let's just.
It's because they say the PTO or PTA are against it. So I don't know if that's true or not, because I'm just relaying the information that I'm hearing. If it's not true, I mean, like I said, I'm definitely down to do a presentation. But
Let me set the record straight. I love Dave Miguel's principal, so I'm not bashing her.
Your kids are getting.
She and I just go head to head on that. I mean, she's like, it's just too much sugar, and then I hear you say, no, it's the lowest amount of sugar, and so
lower.
Well, lower.
Yes, lower.
Lower. You're right.
Compared to store-bought. So I feel like I opened up a can of worms.
Yeah.
And the whole like chocolate bar, right? And
Yeah.
it's like, oh my God, and this was so difficult for our program because we're like, yes, and I used to be like the chocolate milk, you know, like here she comes, watch out. There goes your chocolate milk, right? But again, it's more about balance, right? So we do smarter lunch movements with our schools and our cafeterias, and we figure out ways to nudge the kids. So we put the chocolate milk in back of the white milk. So they're all talking, they just grab the milk, right? And unless if they really need that chocolate milk, right? So we work on different ways, different techniques to influence them to eat more fruits and veggies, right? Whether that's with our staff, promoting it, you know, because the teachers walk the students in, all right, let's get our white milk today, right? So when they hear that word white, you know, it might have them pick a white milk up. So there's ways that we can manipulate, if you want to say, to nudge them a little bit to make that different choice.
I think part of it is the education component too. Like, I mean, just knowing, okay, chocolate milk's probably not there's more sugar. Obviously, it's a different color, it's chocolate milk, there's added chocolate. But there is an education component, and Barbara Ann told me about how fat absorbed when she first started. I'm like, okay, but do you want to explain that?
Sure, yeah, put me on the spot. You know, thinking about the regulations, it's interesting that the fat-free milk that we have is the one that's full of sugar, because when we think about protecting people from diseases like diabetes, well, we need that fat and that protein to help slow the absorption of that sugar. And so that, to me, makes no sense. I think that there's going to be chocolate milk around the world. Like, you know, kids are going to see it, and we just really need to be very clear with them on, you know, there is extra sugar in this. Let's think about how we feel when we drink it. If you drink this whole case, how would you feel? Probably not good, you know? But also keep in mind it's about balance. And so if that chocolate milk is a treat for them, and it does provide that calcium, but hey, they also know that broccoli contains calcium, and, you know, fruits contain a great amount of calcium. Really, milk is not a super great component. It doesn't have a lot of calcium compared to a lot of fruits and vegetables, right? It's added, there's a lot of phosphorus in it, it disrupts the absorption. And so I think all of that is a great learning opportunity. I love to hear that the students came together to present and learn. That's wonderful. Can't we just do that with all the things? Like, make an argument about it, learn more about it, and maybe you'll get your chocolate milk. I think it does,
Right?
but I didn't want to say it.
All right, I think we have
that
time
memorized.
for one more question on that. This has been fantastic.
Are we on now? We've got a couple online comments. One from Heather Williams. Healthy things are a lot of times, most of the time, thrown away. Talk to any grocery store or food bank employee. We need to find a way to reach the masses on how to make fruit and veg appealing through education and health promotion. And then Brian Eller, I appreciate the mention of agriculture and implementing farm-to-table strategies. The connection with school gardening to support nutrition and counseling, psychological, social services can be a great way to get multiple modules of WSCC at the same time. Any examples of schools that you work with making this connection?
Star School, without a doubt. They've been doing it for 20 years that I've known them. They have a garden, they have chickens now, they have solar, they've gotten tons of grants to support it. So we try working with our farmers, North Loop Family Farms, to come and educate Talani Lake farmers. There's tons of farmers that will come and teach the children, the students, provide that gardening knowledge and to grow with them. Like we even provide little take-home kits with some seeds and dirt, you know, to try to promote that home gardening. We have seed to supper classes. So there's a really big push for gardening. And I know the Tuba City area has had gardening for years, right? Community gardens, and then trying to create that farmer's market. So yes, we see that connection. And when the kids do grow their food, they eat it, right? They love just picking it off the vine. Killip now, our U of A Cooperative Extension is a beautiful resource with their master gardeners to promote that. We work with the Family Center Food Bank, Flagstaff Family Food Bank, and they just had 2 small little plots, but they actually used the food that they grew in the meals that they prepared, which is great connection. So yes, it's a beautiful comment, and I think we're seeing more of it, and I think COVID helped with that, because that's what you could do. You could garden, right? So that was really one benefit that came from people being at home and thinking of being resourceful with their time. Yeah.
Thank you all so much. And so give our panel a hand, please. They will all be around after we're done with all 3 panels, so hopefully we can get some more conversations and discussion about how to collaborate and get together on the nutrition side of things as well. This theme of it takes us all working together as a community is coming through. We've got to communicate, work with families, we've got to work with schools, so we've got to work together. So, all right, next up, as our physical activity panel is coming on up, come on up, y'all can just choose a chair here, and so we're going to move into the physical activity panel. So we've got 3 fabulous folks here. We've got Dr. Monica Eklund, and she's from Arizona State University in the Mary Lou Fulton Teachers College. We have Kim Austin, and I'm going to mention Safe Routes to School. She's a physical activity and active commuting guru. She also works with the Coconino County Health and Human Services. And then we have Martin Ince. So we have the City of Flagstaff for Metro Planning. So we get to see some of the environmental planning side to support physical activity. So thank you all for being here today. And I'm going to just turn it over to you 3 to spend, up to maybe 5 minutes just introducing yourselves and what you do.
Sure. My name is Monica Eklund, and I work in the PEAT program down at ASU. I'm also a secondary education clinical assistant professor. I have worked in K-12 public education in the PE field, PE and health field for 10 years. And then I moved up here and worked with Steve, which was fantastic. And then I got my doctorate at GCU, and then I moved down to ASU. And this is my first year as the program strategist for ASU.
I'm Kim Austin, and I work at the Coconino County Health and Human Services. I was hired a long time ago, in 2007, to run the Safe Routes to School program. So Coconino County had a grant from ADOT, and it was wonderful until Congress changed the funding sources, and Arizona got to choose. Okay, I'm going to mess this up. Arizona got to choose where their Safe Routes to School money went, because only high population counties received it. So Pima and Maricopa automatically got off the top, but all the other counties did not, and consequently, the funding went away. So thankfully, my supervisor absorbed me, and I still do as much as I can. I definitely promote walking and biking to school. We do walk to school day, bike to school day, It's Bike Month, if anyone doesn't know this. And yeah, my legs are super sore because that's all I've been doing. I'm a league certified bike instructor. I don't know what else to say. I think everyone should walk and bike to school and work. Yeah, there you go.
Hello, my name is Martin Ince. I'm the multimodal transportation planner for the city of Flagstaff. That title's a bit of a mouthful, but just think of it as I do transportation planning for really everything that isn't driving a car. So part of it includes planning for the city's FOOTS system, that's the Flagstaff Urban Trail System. Another part of it is just helping accommodate and encourage walking and biking of all forms. Late last year in November, the city passed its active transportation master plan. It is essentially a document that's intended to provide a way for us to encourage more walking and biking. But more than that, it is a document that encourages a different way of thinking about transportation, and mainly just getting away from having kind of a vehicle or car oriented focus and thinking about transportation in terms of giving people more options. Of course, we think of walking and biking and transit as being legitimate options, but we really have to work on making that happen. There are other options as well in transportation beyond that, and we just want to make sure that when people travel, that all of those options are attractive and legitimate for people. So if you want to do something else for your travel, you can. Ultimately, the upshot of that is that people have better mobility. And we often think of our own mobility in terms of how long does it take to get down Milton on a busy Friday afternoon, or if you live in Cheshire, how long does it take to make a right turn out when Snowball is in. But I think a better way of thinking about mobility is to think about the people in our community who have the most challenges for mobility or have the most difficulty getting around for a variety of reasons, and I think children would fall into that category. And if we can improve mobility for them, then isn't our community more mobile overall? And we'll probably just end it right there.
All right, fantastic. Well, we're going to start off with a similar question to the nutrition one. So what is the connection between physical activity and then child success in school?
You go.
Okay.
This is your dissertation. Go for it. Do it.
Just leave the rest of us some time.
There's just so we all know that physical activity is important. And I did my dissertation on incorporating physical activity in the academic classroom, and this is why. There were 3 different occasions. The first one is I had a student in my class, and he was phenomenal, but he had to move. He just had to move. And he took math, and then he took PE, and he was failing math. So I went in with him and his family to his IEP, and I said, I'm going to propose something. I want you to flip him. And I want him to take PE, and then I want him to go to math. And he passed math. And I was like, there's something here. I kind of know what it is because I had Palmer as a teacher, right? So I kind of know what it is, but I need to know in depth why. Why did that make such a difference that he passed? So then I started doing my dissertation on incorporating physical activity in the academic classroom, and this is exactly why. I had to write it down. Look at my page. Because there's so many. Okay, so let's start with the teacher. Ready? I'm going to be a teacher. Tell me, why is physical activity so important? What does it do for your body or your brain? For real, tell me. Blood flow.
Time on task.
Time on task. Wait, I got to start checking these off. Okay, keep going. Engagement.
Stimulates the neurons to help grow.
Neurons.
Gets the wiggles out.
Gets the wiggles out. What about mental health?
Yes. You're happier.
You're happier. Decreases depression. So I'm going to go with just the youth, since we're talking about youth. Positive effects. and I have a list. So
You're taking all of my stuff.
Oh, sorry.
No, I'm kidding.
Cognition,
Go.
emotional
No, go,
health,
Monica,
physical
go.
health,
Go.
improved levels of physical fitness and academic achievement, such as grades, attentiveness, concentration, have been reported, along with improved social and emotional, mental, and physical health, positive effects on executive function, selective attention, reduction of anxiety, depression, and improved social development. Okay.
No, I have more.
Oh,
No,
keep going.
I do. So 10 to 14% of the traffic in the morning is due to parents driving kids to school. I don't know if anyone has been at a school. If you don't have children, you should go observe the chaos in front of a school. And so that is alarming. And I cringe, I worry, a kid's gonna get hit, a kid's gonna get hit, something's gonna happen, right? There's so many cars. Okay, and then let's talk about pollution and the air quality around a school. You then, right, parents, school's out, let's say at 3:20, so they show up at 2:45. 2:30. Okay, sorry, Jamie. They show up at 2:30 to sit there to be the first in line, and then they leave their car running, and every other car behind them leaves their car running. So the pollution around schools are terrible. Increased asthma. I mean, let's just go there, right? But more than that, letting your kid walk and bike to school fosters independence. And I don't know, you learn so much about your children. Here's an example, and then Martin, it's up to you. So we had a bike event just this, a couple days ago, and a mom had planned on riding, but her other kids got sick. But she came and she was gonna let her daughter ride. She didn't have her bike. So I let her use mine. And she came to me after and she said, thank you so, she was actually a little bit teary. She said, thank you so much. I don't have much time with my oldest because my other two take so much time. And this, I learned so much from this 30-minute ride. We had a conversation while we were riding. It wasn't like, okay, sit down and look at them and have a we were actively doing something while having a side conversation. She said, I learned a whole bunch about my daughter that I didn't know before. And so parents don't understand that, So go ahead, Martin.
So in 1969, which some of us remember, about 90% of kids, K through 8, walked or biked to school. In recent years, would anybody care to guess what that percentage is? So K through 8, kids who walk or bike to school. In 1969, it was 90%.
I heard 5, I heard
Guesses?
10.
Less than 1.
Well, it may not be as dire as we think. It's about 11% of kids walk or bike, and they're, that's dire. Yeah, it's not 1%.
Yeah, you're right. It's not 1%.
And there's a number of reasons for that, some structural. For example, where we used to have and build neighborhood schools, schools that were smaller that served a neighborhood. Now we build high schools and other schools that resemble university campuses. They're enormous, and really the only land that's available for that is on the outskirts of cities, so they become kind of decentralized as well. And then over the years, there's just been a lot of changes in how people think about how kids get to school. I mean, when I was a kid, if I would have dared to ask my parents for a ride to school, I can't even imagine what the answer would have been. But now it's become really a lot more normal. So part of our challenge, and this is what Kim has worked on over the years, is how do we get people to switch? How do we encourage more kids to walk or bike? And I think it kind of goes back to that, the principle of providing people with choices or opportunities and how they get around. So if driving to school is the most convenient way, and I would argue that it's really not. I mean, you see how much time parents spend in pickup and drop-off lines, and I can't imagine how that's convenient for them. But when you think about other choices, the convenience kind of drops off. Like for example, if you're taking a bus, you need to figure out the schedule and where it picks up and drops off. And even those small tasks can discourage people from doing that when it's so much easier just to turn your car keys and away you go. So part of our challenge is just making other forms of transportation that much more attractive or that much more convenient. So it doesn't take really any extra effort for people to use them. And for kids, I think being able to walk or bike to school, of course, is the easiest way to get them exercise a couple times a day without really thinking of it. I generally ride my bike to work, except when there's a lot of snow. And really, I haven't intentionally exercised outside of that for about 15 years. So that, I'm kidding about that. But really, riding to and from work is a great way to sneak in a bit of exercise, and for kids especially. And then Kim mentioned some of the other benefits, socially, with doing that for kids and adults. And one of the biggest things with learning to walk or ride your bike, if you ask people like what was the feeling that you experienced when you learned how to ride a bike, inevitably the answer is that people felt a sense of independence that they never had before, because they can take themselves places and transport themselves without having to rely on their parents. And we know there are a number of other benefits as well, like when we walk or bike, we get to know our community a lot better than we would otherwise, just because it's such an immediate experience with your community. You see everything that happens, you're going at a much slower pace, an experience that you don't really have when you're driven.
I love the idea of communicating, hey, I got to actually talk with my child. It's because when they're riding a bike, they're not doing, here's on the phone, right? So there's some other benefits to that. So what are some programs? What are some opportunities? Well, let me step back and read my script here. There are school-based programs, there are city planning programs and efforts to really try to make it safer, or to try to get kids to actively commute, right? And it's really, once again, it's coming down to families and parents being okay with it as well and getting out. But I don't know, how can we come together to support and then encourage walking and biking to school? And this comes from the kids, the teachers, parents, the city, and planning. What are some of those things we can do? And maybe that's even participating before and after school programs. I mean, it's wide ranging. What can we do to kind of come together to try to bring that 90% back in the act of commuting? Of course, there are barriers. What barriers are there? So I know it's kind of a broad question again, but I don't know if we can dive a little deeper into some things that we can do.
You should do the teacher aspect of that, which is classroom.
Yeah, for example, there was one online question that said, teachers said, hey, I've got 100 minutes with kids. And hey, we do this, and it's supposed to be a 2-minute activity break. Then next thing I know, I lose 20 minutes of class trying to get them back in. So there are challenges with teachers too.
So, if you're at school, let's say 7 hours a day, what percentage do you think kids are sedentary? 70%. So you talk about walking, biking to school, you're already alleviating for the day, because they're spending 70% of the school day sitting. And they're not allowed to fidget, right, because they get in trouble. And they're not allowed to spin in their chairs or lean their chairs, so they just sit, okay? So one of the things that I really promote is incorporating physical activity in the academic classroom. And just like Steve was saying, that could be something small like, and I still do this with my students, my ASU students, in all of my classes, is I incorporate brain breaks. And a brain break is 2 minutes. It can or doesn't have to involve whatever you're learning about, but it's just a 2-minute break where you have to get up and move. And what I do is I give an example, and then my students have to sign up. It's not worth a grade, because we don't want to put pressure on them to do physical activity. So it's not worth a grade, and it's just fun, and they have to teach the students or do something with all the other students in the class to incorporate physical activity in the classroom. So that's easy when you do it with college students, because they do it and then they're ready to sit back down after 2 minutes, right? But you get kindergartners out of their seats and they're like, I'm gonna live out of my seat, right? And so one of the challenges that I found in my research is classroom management, or how do you get them to settle back down after they're making paper airplanes and throwing them at each other? How do you get them to settle back down? So what I would recommend, and what you have to have as a teacher, is you have to have those protocols in place first. So having a practice where they get up out of their seat and then they sit back down, and what that actually looks like, what that feels like for their body. What does it feel like when you move? What does it feel like when you sit down? Let's practice actually standing up, doing a physical activity, and then sitting back down. But if you don't establish those protocols to begin with, you're gonna lose them. And not just if you incorporate physical activity, but you're going to lose them in everything that you do. So that would be my recommendation for that.
I feel perceptions, I don't know, barriers. Well, it's like Martin said, it's easy, right, to get in the car and drive. I feel like, and you're going to speak to this, the built environment. If the built environment is there, then it takes away, it makes it a little bit easier to have your children walk and bike. And also this perception of it's not safe, right? It's not safe for my kid to be out walking and biking. And that's not true. And I'm not sure how we change that perception. But I'm thinking that maybe at the school level, if the school came up with a commitment, starting at the teacher level, moving into the administration, but that school has a commitment that we're going to have less cars at our school. Some of the Gold Star, let's just say Boulder, because their Gold Star, their parking lot is empty. And it's actually, if you get driven to school, it's like, ooh, your mom drove you to school today? Like, oops. Teachers commute, the students commute, the administrators commute, everybody commutes, and that is the norm. So somehow, maybe it starts, at a teacher trying to encourage, 1 day a week, of meeting and riding to school, or whatever it is. But it has to start small and build big. But it can't be someone from the outside coming in. It can't be, while there are community and city programs, for it to be sustainable, it has to come from within. Because I can't come in and say, okay, once a year, let's walk to school today. We have a great time, it's wonderful, but then everything goes back to normal. So then I go to the, this is actually what I did. I went to the transportation, I said, well, we happen to drop the kids off once a year. Can't we do that once a week? It happened, nobody got lost, everyone made it to school, and they're like, oh no, liability. It came back to liability. So how do we combat that? So then this, I don't know. I just feel like it needs to come from within at the school, changing the perceptions. And then all of a sudden, the parents are like, oh, so we're walking and biking more to school. That's what we're all doing. Then there are more kids out on the roads. People are more cognizant. They slow down because there's a lot of kids. I think that we get the wheel turning in the right direction, and then everything starts to fall into place. And then all of a sudden, our kids they get all sorts of physical activity. Their grades go up, and everything is, yay. Okay, go ahead.
I'll talk a little bit about barriers in the built environment, since that's kind of what I work on. So the city's active transportation plan does a pretty good job of inventorying where we're missing sidewalks or street crossings or foot trails or bikeways. But it's kind of done at a citywide level, so it really is fairly general. In walking and biking, one of the principles in design is that you have to get the details right. And I think one of the things that we could do better is to assess the situation immediately around schools to kind of see where we have opportunities, where we have challenges. And part of the Safe Routes program includes kind of community-based or parent-based or school-based audits of the environment around school that they get into a lot of detail and are really intended to involve the community and involve the school and including the kids that go there to identify where there are good things happening, where there are bad things happening, where there are problems in the built environment. And doing that, you can develop a plan or a list of things that could be improved to overcome some of those barriers in the physical environment to allowing people to walk or bike to school. Usually it's easy to come up with a list and to get through that process. Usually that list ends up being in the millions of dollars for projects. Infrastructure is just expensive. Fortunately, there's hope. One, the city passed a transportation tax in 2018 that runs for 20 years from 2020 to 2040. A portion of that, not nearly enough, in my opinion, is dedicated to ped and bike improvements. So that's a funding source that we have for 20 years, which is, albeit insufficient, it is money that we have. And then the second one is at the federal level. And last year, the government, Congress approved the infrastructure bill. That I don't even know how many trillions of dollars it is. It's a lot. But there's a ton of new grant programs available. And there's two common themes in a lot of those grant programs. One is that there's an emphasis on active transportation, so walking, biking, and transit. And two, it wants to award money based on social equity as well. So if you can meet kind of those two criteria, there's a lot of money available at the federal level. Most of these programs are new, so they take some time rolling out. And because we don't have much experience with them, we kind of have to, figure out what they are and get used to them and see what projects we might have that match some of those programs. But I think the idea is that start with the planning and identify what your needs are, and then money more easily flows to those plans versus thinking that we need money to solve these problems. So figure out what they are first, and then think about that money. And I don't know, is this a Flagstaff generally focus group, or are we from everywhere?
Technically everywhere.
Technically, okay.
But most folks
okay.
are Flagstaff.
Yeah, I guess what would apply to Flagstaff would apply to anywhere. I mean, get in contact with local government, figure out who does transportation planning, figure out who are the your council members or on the planning commission or whatever. Maybe start with the school district and just kind of make those contacts and see what funding is available. I know, for example, the city's is thinking about additional bonds, and to me, it feels like more money for active transportation or just kind of sustainability and livability in general would probably do well. And I think we could come up with an attractive bond package that the voters would approve. But think about those opportunities, because this is really an unprecedented time in terms of the federal money that's available. So right now is the time to take advantage of it.
So I'd like to encourage you, if you have ideas, use that QR code, really start putting those in. The more times you put those ideas in, it'll show up bigger. I will show those later on, and maybe we can use it to see what emerges more, but I think those are some great recommendations, and let's see what kind of groups we can get together to maybe put something together that might lead toward that.
Well, and I will say, what you could start at a classroom level, and you can have the teachers take their class out and do a walkability audit of their environment around school. And they're all over. You can just look it up, but how, you rate it. Do you feel safe walking? Are the cars driving too fast? And the kids can do this. And then the teacher can take this information, and then move it to the next level, and say, okay, all the fifth grades or whoever did all of and this is what we came up with, and come up with a theme, and then take to the principal. This is the problem that the kids, have identified, right? And move it from the kid level, almost like the presentation of the chocolate milk thing. So, and then from there, the principals can discuss, because they have meetings, they can discuss, okay, this is at school. Maybe there's an overlying theme that needs to be addressed, or whatever, and then move it that way through the system. Started at the kid level. If the kids are motivated, boom, people listen. Are there any more questions?
I've got some. Well, I'd like to open it up to you all and online. Does anybody have any questions for the panel? I mean, I've got other questions, but I'd like to open it up to you all. Anybody got anything jumping out?
I will throw out there, ADOT is bringing out some Safe Routes funds, I believe. We don't know what it's going to look like yet, but there are some dedicated funds for infrastructure and non-infrastructure grants. And I can explain if you don't know the difference with those, but and then Safe Streets for All, right? That's another good source. But yeah.
So a lot of this conversation actually connects with what, there's the physical activity component of the whole school, whole community, whole child, but then there's actually called comprehensive school physical activity programming. And there are 5 elements to that. There is, of course, physical education, which is trying to get kids to learn to become skillful and become physically active for life. That is our goal. It's not just about gameplay. Then there's before and after school activities. There is during school physical activity, which is some of what Monica had described. I kind of feel like we need to do a quick, 30-second activity break here, but you can get your coffee. We'll keep rolling. And then we have staff involvement and training, and that comes back to some of the funding as well that Carrie had shared. There might be opportunities there. And then there's also family and community involvement, and that's where from the city planning side of things, there are ways to bring the community in from a design, but also getting families involved. We heard some strategies, such as from Tuba City. They mentioned a lot of the schools were opening up facilities for families to come work out. That is one strategy to try to get the families involved in the schools. So I'm just kind of talking this out loud. What are some things like, okay, here's my magic wand. Here's what I could do to try to really get more physical activity going. Here's what we could do. And let's say it was, forget the funding. So it was such as what Martin mentioned. Let's get the idea first. Forget the funding. What would you do if you had your magic wand? And then maybe we can get some groups here to help go after that funding. What's the magic wand thing? What would you do?
So I've noticed kind of a theme here, which parallels my research, is lack of knowledge, right? So and it's not my opinion, I found in my research, is training. So when you were saying about if you get one school to start, and more kids at one school are walking, let's say, bringing in some of the staff from a different school to be able to come over and see what are you doing differently that we're not doing at our school. So training, and it's not once a year training, it's you're doing multiple trainings throughout the school year on different ways to incorporate physical activity outside of the classroom, inside of the classroom, and then with community involvement. So I think, and then to piggyback back off of that question, if you have the magic wand, it would be allowing for training so that people are more competent. Because if they're more competent, they're more confident, and if they're more confident, they're going to do it. So it's more of what trainings do we provide, or how do we get people educated? Small steps. This school walks to school. Most people walk to school here. This school doesn't. I'm going to have 3 staff members. Doesn't have to be admin. 3 teachers come to this school to see what they're doing different. Simple.
Yeah. Well, and you're right. I think a lot of adults don't know the rules of riding, let's say. I mean, how many people ride on the wrong side of the road against traffic in a bike lane that's actually meant for the other direction?
Because it's safer. You can see the car that's about to hit you, right?
No, that's a walker. It's a walker, not a biker. So I think you're right. Education, definitely. But then also, let's talk about, I know this is I'm going to rip a Band-Aid, but because we said magic wand, right? Climate change, we all know, right? Communities are starting to enact climate initiatives. And so one huge impact would be less kids driven to school, right? So, we could take it even a step further with that. So the schools need to be healthier, pollution-wise, right? So let's throw that education in there too. How does walking and biking to school impact the environment around the school, the climate of our town, all that kind of stuff?
Yeah, I don't know what I have to add to that. I guess just in the way of eliminating barriers. How do we change the mindset around walking and biking? We've always thought that we want our walking and biking facilities to be safe. And when people answer our surveys and talk about what are the barriers to walking and biking, they always talk about in terms of walking isn't safe, or biking isn't safe, or I don't feel safe. And I really believe that, that safety is important, but I also believe that it's a really low bar for us to hit. Like, we can provide things that are safe. I think a better measuring stick would be, can we provide things that are comfortable or even attractive and appealing? And once we get to kind of to that level, of course things need to be safe, like we don't leave that behind, but can we take it a little bit further than that and actually encourage people to do those things? Of course, when you talk to the public about that difference between safety and comfort, it really just kind of falls flat because it all kind of comes back to safety. But I think if we made things that were comfortable, then that would really resolve that safety issue. And so, what's the best way to do that? And I kind of pose this as a question. I'm in the business of providing facilities, so do we provide the facilities and then people, start to change, they see this and they start to change their mind, or is it more, do we need to talk to parents and to students and to the school and to get them more educated about, what actually is safe and what is comfortable and what their options are?
Yeah, right, watch out.
Are we done?
Is this even on?
No, I'm just kidding.
Well, to me, it's really a larger issue about the culture in the school in the first place. And like for young children to sit when they're not ready. And we're expecting them to do that. And so they're already kind of in a stressful situation. But go back to the gardening issue, there's so many different things that we can incorporate, say with gardening, that can incorporate the academics and the curriculum, but can also incorporate the physicality. So I think so much of it is about the culture of the school in and of itself. So having something like this times the whole country where people are, this kind of a forum, and then connecting in with other people to really start making the shifts, because I think it is going to be at the community level, and then we can impact the political decision makers. So I just wanted to, that was my input.
Well, I agree with you. So we need to change the culture of our education, because look at other countries, right? That education is a physical education. Let me go. Physical activity, there we go, is a third of their day. And their test scores are off the charts. And it's not translating here. And so if we could change the mindset to where more physical activity equals higher test scores, not more time in the seat, more time studying, does not equal higher test scores. It just doesn't. And we need to change that mindset.
So that's been proven. I mean, that's been proven.
It is, yes.
However, when there are barriers, or when you're told this is how students learn, they sit in a seat, or they don't know how to get their classroom back after they get them out to go do gardening or a brain break or something simple where they're moving and they don't know how to get them back. Those are all barriers. So it really does come down to trainings and then removing the barriers to be able to, and then educating staff or educating admin on a decrease in physical activity does not equal
No, it's not.
anything, actually. Doesn't really equal
No,
anything good.
no.
Everything bad.
It equals really chaotic classrooms.
But you have to say that. You have to say that.
Right. Absolutely.
And I think there's a disconnect often between how teachers are trained
Yeah.
and what's happening in the schools today. And that's just one of those challenges. And with the teacher shortage now, we're seeing much higher turnover and attrition rates in schools now, because you have more and more folks that are finding their way into classrooms without training to know the protocols or how to set the routines up to keep their classes, get their classes back. And so maybe my magic wand is, let's pay teachers more than MDs, and let's see what happens in schools. So anyhow, sorry, we'll go back over here to another question.
Hi, I'm wondering what you guys think about, what is really causing or contributing to this idea of, or this feeling that people are unsafe. I am a recent news watcher. I'm preparing to move down to Phoenix, and I've seen, I think just in my own personal life, just how the media has contributed to me not feeling safe. Are there any initiatives to kind of control just what is being said on the news when it comes to people feeling safe?
Good luck with that one.
I got nothing on that. All I can say is, back in the day when everyone was walking and biking, there was no social media, right? The TV went off at midnight, and it didn't come on till 6 a.m. And that's not the way society is anymore. I am not sure how to combat that.
So, physical activity decreases depression, anxiety.
It does.
But more than that, I hear just as a parent and in my neighborhood, I hear other parents say, well, I'm sending my child to this school, and it's not because they're an A+ school. It's not because they have high test scores. It's because they feel their child is safe at that school. So feel free to answer, because I would like to know the answer to the question, because I don't have an answer to that question.
That's so subjective.
Yeah.
What is feeling safe?
Can I throw out an idea we'd have? I'd like to hear a comment, unless Martin, you had something to add before.
No, go ahead.
I was going to say, there was a friend, Jay Sutliff, he's nutrition faculty here. We said, you know what, there's a difference between the perceived safety and the real safety, right? Why can't we get somebody like Verizon or some kind of phone carrier? All the kids have these. Well, let's even give discounts to their service. Have the kids carry the phones around. They're safer now than probably when most of us were growing up. We disappeared all day long. You know, our parents wouldn't have known if the white passenger cargo van, picked us up or not until we didn't show up for dinner. Right? I shouldn't joke. That's a terrible thing to joke. But they wouldn't know. Now kids are all so connected. I would argue it's probably safer today to be a kid because we are so much more connected with our parents. Our kids are more connected with us than we were. Maybe there's some intervention we can do there. The other one I wanted to bring up, Kim, you had mentioned as a way to kind of bridge that gap, you'd mentioned the biking bus? No, the active busing. Can you share that idea? That is such a wonderful idea that says, hey, yes, we understand you are concerned about the safety, but here is something we can do.
So when I was the Safe Routes coordinator, there are schools that have really big boundaries. And it would take the whole day for a kid to walk or bike to school, right? On the reservation, you name it. So my idea was, hey, let's have a Safe Routes to bus, right? So let's have, some kids have to walk a mile to get to the bus stop. That's great, at least they're walking there and not being driven. And I was shot down. Because they said there's no such thing. I'm like, well, why not? Why can't kids walk and bike to buses, right? Or have less bus stops in a neighborhood. In my old neighborhood, I think there were 7 bus stops, and they were not very far away. And I thought, really? Can the kid not walk down the street? Maybe skip every other bus stop. And so I know that busing, there's a funding that districts receive, and I don't know, my father tried to tell me all about it. He was an administrator of a school district, and I sort of quit listening because I think I needed a brain break from that lecture that I was getting. But yeah, I needed to move a little bit more. But anyway, I know that there's funding, and so transportation is a big funding source, for monies for districts. But it seems like your buses would be better off with less stops, less start, stop, stops, the brakes and all the maintenance that involves, if there were less bus stops so the kids actually walked a little bit further to the bus stop. I don't know. That was my thought. I like that. So.
I maybe offer there's a lot of examples from around the country of communities that have reclaimed streets, so physically redone them to be less automobile dominant and more for all kinds of other activities, walking and biking in transit, but also, walking, strolling, hanging out with your neighbors, all kinds of things. And maybe if there was more kind of local publicity for those kinds of efforts, it would feel a little bit more hopeful that there are things that could be done, that it is possible to make a positive difference in your environment.
We've got one question?
Yeah, before I pass this to Teresa, I think Heather made the comment, why not put the bus stops to the school a half a mile to a mile away from the school, which I thought was actually pretty clever.
Yeah. Sorry. So we try working with physical activity with our schools that we work with, and one way is a shared use agreement. And I know Tuba City Regional has a great partnership with the schools there. They open up the gym. They have 200 people come and do Zumba or whatever, right? So it just seems to be a struggle. And again, it goes back to liability. Like, families can't even go to a playground, school playground, because it's locked. So how can we amend that?
I don't, Steve? It's a liability, so it's
frustrating.
That is a higher up, I think.
Especially if you have a school in a neighborhood, that should be the place, the gathering place for activity and fun and gardening, and like that, in theory, that should be the place. But no, it's locked and you can't get in.
I have to ask what schools are locked, because Dave Miguel is not allowed to lock our fields after school because it's public property. So, okay, so in Phoenix, but.
Seacrest is pretty locked down.
Is it really?
Yeah, so there are schools, it's all about.
Too. I
Yeah.
feel like Killip is locked.
D. Miguel fields are used for Little League and soccer practice as well, as which is why it's open. But that is a challenge, and that's one of the biggest challenges in the whole comprehensive school physical activity programs, is getting family and community involvement and trying to get them into the schools when we can't open it up for.
So do we think that the reasons for locking playgrounds like that goes back to the question, is that actual safety concerns, or is that perceived safety concerns? Or is it an overreaction to liability?
I don't know, that's a good question.
I would say liability and vandalism,
Yeah.
That's what I would.
Yep, yep. I don't know, the world needs more broken bones. Maybe roll the dice, get out there a little more active. Yeah, I don't know, that's a conversation for another day.
That's a
You know what, how about a hand for our physical activity panel? We're gonna move on. So we're going to transition to our mental health panel, but at this point, since we're going to try one quick brain break. So introduce Tori Damjanovic. Thank you. I'm 0 for 7 on names today. And she is an assistant professor in early childhood education at NAU, and actually she's going to kind of moderate and facilitate this discussion. Did you know that?
I did.
Absolutely. We also have Jamie Smith, who's a school counselor at D. Miguel Elementary School, and I think Jamie must be grabbing a cup of coffee, so she'll come up here shortly. We have Renee Redday, who's an engagement consultant with Building Community Flagstaff. And then we have Virginia Wadahomiji. She's the executive director of the Coconino Coalition for Children and Youth. And we're going to shift into our mental health panel side of things. So can I just turn it over to you, Tori?
Sure.
All right, thank you.
And we're waiting on one more.
Yeah, we're waiting on one more. She's probably, I don't know, this is our speed dating.
Okay,
something.
there she is.
So
Come on
that's
up.
Try not to spill and walk fast, it's not working.
Well, I figured we would begin by having everyone that is on our panel speak about what they do and where they are situated when talking about mental health with children. I think we all come from different areas of expertise, and so I think we have like 5 to 7 minutes-ish, if that way we have time for questions and stuff. So do you want to go ahead and begin?
Sure. So I'm Renee Redday. I am here in Flagstaff. My background is in early ed and family development, but a handful of years ago started a business really focused on community relations. There was so much work that I was doing in the community, and I think that there's a time to offer our community information, and I also think that there's a time to ask the questions so we make the right next move collectively. And I really wanted to be a part of the one asking the questions. So I really love those opportunities within community to build social connections and tap into the lived experience of those in the community or that are impacted by the schools and the programs that we've all been speaking about tonight.
And I'm Virginia Wadahamaji. I'm the Executive Director of the Coconino Coalition for Children and Youth. And my background actually started working in residential treatment and directing foster care and treatment foster care programs in Southern Arizona. And so when I had the opportunity to come up here for a prevention program and a community coalition program, it was a really exciting opportunity to look at healthy communities and how we look at the prevention side and the resilience side. With that background in trauma, working with children in residential treatment, directing programs that children were coming into foster care due to abuse and neglect. Children in treatment foster care may have been in 30 different homes by the time they get into a treatment foster home. So when we're looking at these things, we know trauma is alive and well in our communities, but it's also not just what happens to children in their homes, it's what's happened to entire communities, what's happened to entire groups of people. So in this country, and especially in Northern Arizona, thinking about historical traumas that have happened to entire groups of people. So looking at those traumas that have been intergenerational, have been historical, and that have been current for young people. And then we're also, have to pay attention to the stressors that are happening to all of us all the time. We just talked about the fear. We talked about coming through a global pandemic. We're talking about anxiety and depression. So when we look at the entire system of human development, the impact that stress and trauma has on everything from my ability to process information to my biochemical reactions in the body, we really are looking at systems, approaches to thinking and talking about trauma. One example of what we're doing is when I talk about, in the past I worked in residential treatment, we were directing foster care programs. I had extensive training in trauma and de-escalation techniques and behavior management, 99 hours of behavioral health training required to direct these programs and provide treatment. And then knowing that the school system is seeing these same kids that day and they're not receiving any of that. So that was one of the things coming to the coalition is we've really worked with the schools to get some basic trauma training in there, get some basic behavior management and de-escalation training into the school systems where individuals are seeing children every day with these. But we also look out at the community as well. We know when I'm talking about trauma, I'm not talking about, oh, it's someone out there. It's us. We have trauma. We have histories of child abuse. We have histories of inequities and injustices in our communities. And so we as individuals are traumatized. And if we have never learned that there's skills or hope or resilience or the exercise and nutrition, the yoga, the healing modalities, the therapy, you name it, that I'm also not healing and I'm passing that on to my own children. So from a community standpoint, it's also in the home, but it's also in the after-school programs, it's with the coaches, it's with the neighbors. If we take it back to thinking about a traumatized child who has behaviors from that, it looks to us like they are angry, sullen, dispassionate, they don't care, they're hiding in the corner. They might actually be someone we're labeling as disrespectful or rude or my problem child. And so when we label kids as that, we're perpetuating trauma, we're punishing them, we are carrying this out year after year. So it's one thing to have the trauma that's happened to you, and it's another thing to have the neighbors, the parents, the teachers, the doctor's office, the lab assistant, you name it, further punish you when you're late to appointments, when you don't make eye contact, when you're et cetera, et cetera. So I'm just dumping a whole bunch of information out there, but we really, the coalition's been around for 50 years, and we really believe that some of these ideas of how we promote wellness in the community is really a collective action. It is igniting the community to make changes in our awareness and our knowledge, and then really create policies, systems, and change that really help do that.
I'm Jamie Smith. I'm the school counselor at De Miguel Elementary. I've been at De Miguel for the past 19 years. I, like Virginia, started my career in residential treatment, managing the care of children who were in the treatment program. I then moved here to Arizona, where I took a position with Northern Arizona Regional Behavioral Health Authority as a treatment coordinator and then the Children's Project coordinator. Then got my degree in school counseling, became a school counselor with De Miguel, like I said, 19 years ago. When I first started at De Miguel, I have to say I was fairly bored. There wasn't much to do as far as school counseling. And over the years, I have seen a huge decline in the emotional well-being of our students and a huge increase in behaviors. I spend a majority of my day now managing behavior, and it's emotionally draining. It's frightening what I've seen, what I watched yesterday from a kindergartner just completely destroying a room, and then have his mother come into the room and have him physically attack her, threaten to kill her, and tell her how much he hated her. And this isn't the first. This isn't going to be the last. This is so frightening to me. And so wherever we can help support our children and our youth, I plan to be there. I plan to be heard. And one of the biggest factors I see right now is we need to be supporting our parents. And it came to my mind numerous times in the conversations we're having today. I really feel like our parents today have forgotten how to parent, or not forgotten. I'm not quite sure how to put that into words, because I don't want to minimize how difficult being a parent is nowadays with technology, with social media out there. But I think we need to help our parents become parents like maybe we had. So that's it.
I'll segue because that fits perfectly. So my name is Tori Demjanovich. I'm an assistant professor here at NAU. And before that, I was at the University of South Florida, where I was the director of a university lab school for preschool children ages 2 to 5. So a little bit about my background. I was a preschool teacher at 16, which is now illegal, but that's kind of how I got my start, and never thought I'd be in education, and here I am. But I did my degree in behavior analysis, and from there I started working with children that had developmental delays or are diagnosed with autism. And as I kind of moved through my education, I really got more into teacher education and parent education as I did my master's. And I ended up doing my PhD in early childhood education. And one of the my primary areas of interest is working with teachers to support young children in all types of learning, social emotional learning, STEM learning, and really like how teachers work and interact with children, but also working with families to engage and work with their children and kind of knowing what to do. And right now in early childhood, if you're not in the world of early childhood, the expulsion rates for preschoolers is off the charts. believe it or not, kids are getting kicked out of preschool at astronomical rates. Teachers are struggling. In Florida, where I was at previously, actually trauma-informed care courses became a required course for anyone working in a daycare or preschool space, because they are dealing with a lot of families that are struggling to know what to do. We have teachers that are struggling to know what to do and really how to support children and make sure they're seen. And so one of the things that they've done in the state of Florida, I can speak more to that than Arizona. I've only been here a year and a half, so I'm still learning. But we worked with the school districts to develop kind of social emotional learning and beyond a curriculum box package, but really how to infuse it into the everyday lives of young children that you're kind of teaching in those spaces in between. And, having them learn techniques to self-regulate, how to identify emotions, those kind of beginning steps, modeling behavior for them. And then we would also work with families and have families in too, because we found we worked with all kinds of families, some very highly educated, successful parents that had no idea what to do with their children. And so I think, when, hearing everyone, there is this struggle right now going on, and even social emotional learning has been politicized as something that's dangerous when it's really about helping children feel seen, feel heard, and to learn how to regulate themselves and how to work with others. So that's a little bit about what I do and some of the work I've done. So.
This is really kind of, one of the most challenging topics. And on some levels, we can look at the nutrition and the physical activity side of things that we've discussed. Those are the easy ones. How do we get at this? You know what? So let me ask this. This has been politicized. We know that teachers are now having to take on expanded roles. Can you talk about maybe some of the programs that might be out there for supporting teachers in learning how to better support children through whether it's social emotional learning, building it into the school environment and the curriculum? Can you talk to some of the things that are happening there what would you like to tell some of our politicians that are trying to get elected that are trying to pit one side against the other here?
Emotional learning has nothing to do with critical race theory.
Yeah, exactly.
Absolutely nothing to do with critical race theory.
Right. And I think too, just the system of school right now, and I believe it was you that brought it up, young children especially, I'm birthed to age 8, which goes through 3rd grade. Children are not designed to sit in schools all day. They misbehave when they are sitting in a space where they don't feel like they have any power or agency. If I made you sit here and do worksheets for 3 hours, and an hour and a half of that is on literacy, you'd be rolling around on the floor too. I couldn't sit through it. So, I think there's that systematic, and I think teachers are at a loss because there's so many expectations, this push down of learning, and it's, you must sit and you must do these things. And I feel like, children are just even in preschool, the pressures of, they have to be able to read and they have to know this, which isn't a thing in a lot of countries, and the other countries are doing it better. So, I think that's systematically an issue, but then working with teachers to help, I know what I work with, I teach teachers to teach in early childhood. That's what I do. And they're all asking, what do I do when I get there? And we can teach them all the things. We talk about all of this stuff in our program, but then they get into a school system where they're basically told, no, that's not how we do things here. And then it kind of shuts them down. So, I think that's one tiny piece of it, but I'm sure other people have more to say.
Well, I just want to touch on too, I think sometimes it's the most basic. There is so much that goes on in the world. It's overwhelming to look at, to see. We're talking social media, but we're just talking the news. We're just talking what we hear from day to day. And I think that we live in this age where we're hyper-connected in certain contexts, but we're more isolated than we've ever been. You can do everything from your couch, from your own home. If you're struggling to make bills, cover your bills, or you're struggling with your child's behavior, or you're working more than one job, you can feel like you're kind of chasing your tail, and you might be the only one that's feeling that way. It can feel like this is my struggle. And so I just want to bring, what do we do with teachers? How do we help families? I really want to be the voice for relationships. And I'm glad that the coalition kind of taught me about that neuroscience. Like, it's not just like connections are important because they're warm and fuzzy, but our neurobiology says we have to connect with each other. We need that. And I think if teachers were given more of that permission to just build that family in their class, then they could feel that. Instead of asking the parents sometimes or guardians to always come into the school, like, are we going out to the laundromats? Are we going out to the supermarkets? Are we going out to the sports games so that they don't have to come to our event? We go to them and say, hey, what do you need? What could we help? How can we provide you some more information? But I think I just really want to be a voice for stressing how important just basic relationships and interactions are when you create that in your classroom. Or I try to do that a little bit around COVID in my neighborhood, like knocking on little doors and saying, are you okay? Are you doing all right? And a single mom saying, I'm struggling. I got 2 kids in here and I don't know what to do and I'm scared. And there was other racial context that went along with that too. A president kind of generalizing and in cultures and putting that out there, that as a Japanese mom, she was like, I don't want to go out. I don't want to go out. So I think I went in many different topics there, but I really want to just say that whether you're a parent, whether you're a school, whether you're the teacher in the classroom, that relationships is there. And another piece that I want to say is also just the collaborative piece, because I think a lot of times we can leave a meeting like this and say, what can I do, or what can my school do, or my place, and I think that that's important, but I think it's even more important to say, this is what I want to see happen in my school, my neighborhood, my location. Who else wants this to happen? And how can we do it together? Because when we start doing it when it's aligned, then it's more efficient, it's more effective, and we're saving money. Right? So that we can see these big problems and we don't know where to start. We start with relationships and look around at the table and say, who else cares and who can I do this with?
It's funny that you mentioned community. It just popped in my head. My son, when he was in kindergarten, there was a community day, and the teacher came to see his room. They paired up, and they went to all of their students' rooms at home, and that gave the teacher a lot of insight as to what the home environment was, and I remember him being so excited that his teacher was coming to see his room. He cleaned his room, yeah, I know, it never happened, so except that one day. But I remember that was amazing, and I just remember that happening. He was the only one that happened with, but it was very awesome for the teacher and for the child, for both sides of it.
Gave us the opportunity to see into homes as well, and it was extremely enlightening for a lot of teachers and educators.
Sorry, Steve. Sorry.
Yeah, but there was a lot of negativity with that too. I remember my sister, she got an email from her kids, or her son, my nephew's teacher, because they didn't like the poster in the background, or you know what I mean? Your bed wasn't made, you needed to make, yes, there was a lot of pressure and negativity on that, all of her, yeah. He probably rolled out of bed and just turned on the computer, but anyway.
point. You know, so if you look at the AMLE, the Association of Middle Level Educators, for middle level education, they talk about every child being known well by at least one adult. And those are strategies going to the room, or a way to try to build those relationships, right? But what we're hearing here is that it is a struggle. From Jamie, it's like we're dealing with this all day long, and we can hear the stress, right? So we know there are challenges for the kids, but it also trickles to the teachers, the healthcare personnel. So it isn't just the kids as well, and we've got to be healthy ourselves. We have different community agencies that are there that are meant to really help. So once again, what I'm hearing here is we have different bodies and entities working to support kids. What can we do to try to bridge gaps, get these agencies working together so that the kids are being supported, so that the staff and the personnel at the schools are being supported, that the parents feel supported? What can we do to better bring all these folks together and get us on the same page working with these kids? And I don't know if there's an answer to this one, but what can we do?
They can pull things together.
I'm going to cover quite a few topics that have been touched on today. I think in a conference like this, we need to start getting really real with what has happened. We went from having kids go to school, build relationships with their friends and their teacher, to they take tests all day. And we do drive funding by that. We drive teachers' positions by that. We drive promotions by that. We drive raises by that. We open or close schools based on that. And we've watched that happen over the past couple of decades while simultaneously cutting funding to public education. We have a concerted effort, many would say, to fundamentally close down public education. We are diverting funds to other areas and taking out of the public education system. So there is a piece of us becoming educated voters and really well-informed community members to be able to converse with each other about the topics we're talking about. I'm here as a professional, but I'm also a mother. I have a daughter who has now just graduated with her second master's degree. She has 2 Ivy League bachelor's degrees and 2 master's degrees from Arizona. And she went through the public school system in Arizona and was able to voice this child who grew up like crying because it was Christmas break and, oh, I'm going to be bored and I miss school. Transitioned over the 2 decades she's in school here to get me out of here. All we do is test. I'm bored. They've killed my creativity. I remember going to school in the 80s. Now, granted, I grew up in a national park, but we had inner tubes outside. We were skiing on Friday afternoons. We were taking swim lessons. We had recess every 10 minutes out at the playground. We were outside. Science was at the creek. We were always engaged in puppet shows and arts, and now we sit kids down and we have research, keep them active. We have research, feed them vegetables that they've grown out of the garden. We have research, get them outdoors, but we sit them in a seat all day long. We've also done that to their parents. Their parents sit in a cubicle 8 to 5, 40 hours a week. This is a collective issue that I think we're seeing come home to roost. So over the years of my career, we talk about trauma. And so trauma, everything I'm talking about is going to impact those traumatized families even more than resourced families. However, the level of behaviors in disengagement we're seeing in schools has increased so fundamentally. Most teachers are being hit, assaulted. Most classrooms are having behaviors that have never been seen before on this level. We've certainly always seen these behaviors, and we've been aware of, this student has a special plan and there's a behavior management strategy for this young person. The level of what we're seeing now has not been seen or reported by teachers previously. And so I guess I turned into doom and gloom tonight, but we really need to take a collective, honest approach to what we're talking about here, and we really need to be able to, if the word CRT comes up, what that says to me is, first of all, that's college level curriculum. It has nothing to do with kindergarten, but it's acknowledging that, hey, we've had some really bad things happen in this country, and those are still having effects to this day. We are diverting funds to prisons left and right, and we've never addressed the fact that we don't have students starting on an equal foot when they enter into pre-K, and then kindergarten, and then second grade, and on into adulthood. So I don't know how I got so far off. We've got to come back to being able to have honest conversations, being able to talk, be able to put ourselves in the heads of our young people who are seeing on social media all day that they don't measure up, and they don't measure up, and they don't measure up, and they should probably get a lip injection. They go to school to teachers who are overstressed, overworked, that aren't able to do the passion that they were created for, that they teach and educate and bring, because they're mandated. And then we send them home to parents who are really struggling just to pay rent. Across the board, people are struggling to pay rent and their mortgage. So to any one program, we've got to get really real about coming together across all silos, breaking them down, and really being honest about this.
And I just want to jump in and say, I mean, I love Virginia's passion and what comes out, but I love that you shared kind of the why behind the coalition. We see this, we know this, it's been around for a really long time, but there's a lot of subcommittees within the coalition, from prevention group meeting all together, from advocacy meeting together, and making sure folks know what to take informed action, whatever that means for them, but at least that they have the facts. So just, to the point, how do we do this together? My small way is like, talk to your neighbor and let's figure it out, or talk to the people with the lived experience. But I know as a coalition member, longtime member, how much collective action, that's really what the coalition is all about. Not only the passion for seeing what's out there in the realities of life and how scary it can look and feel, more and more so, but there's action that you can take collectively together. So I'm sure there's many different options, but I know for me, the coalition is one of those, because Virginia's a really great orchestrator of collective action, and a lot of, not just the small, like, let's make one thing better, but as you heard in her, how she speaks, it's like, how do we do this all? And how do we do it together? So I just want to say that piece.
I think too, as mentioned in the last panel, having communal spaces, public communal spaces. And right now, I think everybody's taking their kids to charter schools and all these, so that idea of a neighborhood school isn't the same as it used to be. And I think, everybody seems so disconnected. We're connected, but we're so disconnected in that we're not meeting at the park and having conversations and meeting different people. And, there's such that disconnect. And I see it with young children. I mean, there's 3-year-olds coming to school with iPhones. Parents pass by that, iPad kids, and they don't have a phone plan, but they have access to their apps and their things. And so it's starting really, really young, this idea of doing more of, being on our phones than interacting and engaging with others. And I think relationships, Virginia mentioned this earlier, that, children act out when they're, struggling with their mental health, and you mentioned relationships, right? So teachers having a great relationship with the child makes a huge difference. But unfortunately, those kids that are struggling the most are usually the most difficult to have a relationship with. So, there's so many different pieces to that.
We have a comment from Heather. Seems like the thread through all the topics is connection. Connecting kids to their parents, cooking, biking to school, connecting parents with their teachers, working together and sharing the load, connection with kids to their school, gardening and chocolate milk, connection and compassion.
Well said. Talkies.
Can you hear me? And then Brian asked a question. The lack of resources available in rural communities makes the community wraparound support needed to assist with the implementation of this strategy a concern to address here. Any creative ways you know of that, how that's been addressed? Sorry, Brian.
So I just want to, he used the word wraparound, and that was actually when I worked for Northern Arizona Regional Behavioral Health Authority as the Children's Projects Coordinator. That was one of my projects, was the wraparound project. And it was, the basis was that you wrapped everyone around a child that was struggling. It was the teacher, it was parents, it was the coach, it was just anybody who was part of this child's life would come together and create a plan to support that child. And I've watched that go from a great idea to one where I'll get invited to a wraparound meeting at one of our, agencies that provides mental health services, and it's the therapist, myself, the parent, and the child. And I'm like, they called this a wraparound. No, where is the community that needs to be supporting this child? That's what we need to get back to, making it the community's, it's a community support.
And I think that's one of the reasons why a lot of the work we've done is based on self-healing communities, which is a modality that really looks at the community has the solutions and when the community has the awareness. So in this case, we're looking at if the community's near-informed, which is neuroscience, epigenetics, ACEs, which is adverse childhood experiences, and resiliency. When community members have an understanding of how trauma, how adversity impacts humans, then the community comes together and makes decisions that impact that. This was studied well. They've done it in Washington, and it's not the insertion of programs. The clinician coming into the community is not the answer. That doesn't mean I disparage clinicians at all or things, but we've got to move into this idea of the community can solve their problems when they come together. So if we look at something as simple or as big as childhood trauma, when we understand as a community, geez, many of our children have this. Do we need a special meet up on Saturday mornings to play basketball? Or do we, just hearing the Tuba City presentation of all the community walks and open up the gym and, that's really root community healing work that's happening. And they've shown, these practices of the community coming in is much more effective. A professional coming in with the latest and greatest program isn't actually getting to the core issue. Now, that doesn't negate the fact that our rural areas are extremely resource lacking as far as a therapist, a clinician, a psychologist, a prescribing doctor. So that doesn't mitigate the fact that there's resources there. And again, we heard earlier about funding going to the 2 largest counties on a program and cutting out all the rest. Everything I do at the state is talking about Coconino County, 2nd largest county in the entire country. Like, we really need to understand that when the pandemic hit and young people out in the rural areas did not have access to something anyone in the urban area is taking for granted called Wi-Fi or internet or computer. These really shine lights on the inequities. So I don't want to make light of the fact that we don't need resources in the rural areas and professionals and systems and agencies. But again, coming together in solutions, the contract dollars from the state for these programs, there's usually not a big difference between the urban areas where you can find staff and they have short drives to the rural areas. There's very little difference in contract rates with state contracts for that stuff. There's, what's the incentive to teach in rural areas? How are we resourcing education buildings and communities out in rural areas? We're not. So there's multifaceted, but the point is that we come together, we need to change policy, we need to look at who we're electing and what policies they stand for. But in the meantime, I don't need a special degree to not be an ass to the person next to me. And when I understand that most people who are having some sort of difficult behavior, it's a trauma response, it's a stress response, I change fundamentally how I interact with people on the street. That doesn't mean I'm not human. That doesn't mean I've never flipped anyone off or had an attitude or anything like that. But fundamentally, at my core, I like to think my behavior, my interactions, whether they're children, young people, parents that I come into contact with, if I can leave their day a little better, and we know through heart connections, biochemistry, a million things we don't have time to talk about, that I can positively impact people's mental health just by being near them in the room, even if I don't talk to them, if I have positive energy I'm putting out. So some of it's really big and some of it's really simple that we can do today.
I like that you said that, to build on the self-healing communities piece, and the part that gets me kind of excited in the how. How do we do this? As I think it's by, well, I know, and that's what my business is built on. Go to the people who are having the experience and ask them. Because as professionals, we can know what challenges families or children are struggling with. We might have some good ideas of how we can remediate that. On our best days, we know that this end goal that we have, whatever it is possible. But really, the only way that we're gonna get there is asking folks. I remember being at a Local First conference down in Wickenburg, and there was a presenter there that was from small towns. It was the name of his business, Small Towns. And so, you know, I'm going to give you a broad stroke of the story. I'm sure I've tweaked some details over the last decade, but pretty much there was an area of town that was seedy and some rural kind of community, and accidents happen, people didn't want to go out, and so the city was going to throw all this money at that neighborhood or at that community. But before the guy from Small Towns said he would do anything, he's like, hold up, let me ask people here in this neighborhood what they want. And so they asked, and they were like, trim the trees and put lights back in the street lights, you know? And so sometimes, like Virginia had said, we have a lot, it's not to minimize that there's under-resourced families and under-resourced communities. That is the truth. But the deal is some of the best solutions may not even be in this room. They're going to be where families are, where kids are, where youth are, and to say, here, we're seeing that this is a concern or an issue. Is it? Is it to you? And if it is, what's your idea? Where should we start? What do we do? And so I really think that that's, you know, a component of self-healing communities, but also just really an inner passion of mine of, like, let's ask. If we in this room already had the solutions, guess what? There wouldn't be a problem anymore, but we don't have all of it. We might have lots of it, but we don't have all of it. The missing link is asking the people that you're trying to help. Ask the youth, what do you need more of? Ask the parents, what do you want more of? How should we get that to you? So I think that there's lots of pieces of that pie, but I think the simplest, I mean, really what I proclaim is the most basic of most things, is relationships, and ask questions. How can we be helpful? What's the best way? How do we make this more prevalent? So I think it's really important to not forget to go right along other folks to brainstorm ideas, prioritize, set goals, set actions, all of that, alongside of the people you're trying to help. None of us just going in there trying to help, but doing it alongside of other people, and then we're building connections and relationships too.
Any other questions? I think the community and asking questions is a great way to put it, and I think we all have, I don't know, I'm just thinking out loud about even from a money-making perspective in our world right now, whether it's media, whether it's being elected, it's all based on keeping us divided. And maybe one of those things we need to do is learn ourselves how to separate the extremes that are all built on trying to get an emotional response from us to coming to the middle and saying, look, okay, yeah, I hear you, whatever, but let's talk. Let's get together with one another and hear what we are doing and try not to be influenced as much by the passionate response and emotional response that we are being forced to see every day when you turn on the TV or look at your phone. So I think it's on us and our kids to try to learn and teach our kids how to separate that as well, because that is a big part of their stress and anxiety, as well as, you know, trying to live up to what they see on social media. I think we're about out of time. Yeah. Okay. Oh, any other questions here? No? Thank you all so much. That was powerful. Lots to think about here. I love the idea of taking small battles. It's easy to get overwhelmed with all of these things that on some levels we're not going to be able to change tomorrow. So hopefully there are some things we can do to make a difference now, such as asking somebody, what do they think? Noelle, you ready? So our panelists will be sticking around, I hope. So once again, get the QR codes out. Maybe we can't solve all the big problems, but let's hear some ideas for ways to maybe have some small battles, win some small battles, and take on some small challenges. So at this point, we're going to move on to Noelle and Noelle Veyo. She is with really here to talk about communicating with people, which really is, that last panel was a great segue into her message here. She's a population health dietitian from Arizona Department of Health Services. So Noelle, thank you for being here.
So I have to say, pre-pandemic, I was not so reliant on my notes. But I have really gotten accustomed to presenting virtually and just having my screen right there. So this is like, you know, trial by fire, getting really back into it. So thank you for your patience while I work that out. So thank you all for hanging in, those of you that were able to stay. As I get started, I just wanted to acknowledge that I know everyone, I came from Phoenix up today. I know some of you came from work to this event, so I'm just curious, wanted to see how everyone's doing. Is anyone still like ready for business, feeling good, feeling cute? It's okay if most of us are like feeling whatever, pup number 3. That's totally legit. I'm probably hanging around somewhere right there myself. But I'm really happy to be here with you today. There was so much good conversation. My mind is just buzzing, and I'm like thinking of all these things that I could like touch on, and you know, it's speed dating messaging, language of health. So I'm going to try and stay focused, but there was just so much wonderful conversation around, you know, acknowledging lived experience and the nuances of what communities and people are going through, and you know, what the school environment looks like. And I feel really lucky to do the work that I do and work with folks like you, and I'm happy to share a little bit of that work with you today. So just a quick overview. I'm going to talk about messaging and communication, really grounded in a resource that we've used at the Department of Health Services called the Language of Health. So I'll give a little bit of context, just touch on some key guiding principles, so maybe a few tangible takeaways of when you're thinking about messaging and when we're talking about things like health. And I'm a dietitian, most of my examples are going to be around like food and nutrition, but you know, we talk about health generally, we talked about physical activity today, we talked about bodies and weight and diet culture and social determinants of health and individual choice, and there's so many different elements of things that we have to communicate about and how we can go about that. So I'm going to get right into it, and something that came up a lot today with everyone was just that acknowledgement of the system that we're all working in. And in public health, I feel like we love a good framework. So today we're talking about the WISC model. I've worked in early care and education, where maybe it's the spectrum of opportunities or spectrum of prevention. Our folks from Tuba City shared a wonderful slide that had like concentric circles with an individual at the middle, and then going out broader, you know, thinking about different levels that impact our health. And so Today, just want to acknowledge, the WISC model and thinking about the, 10 different ways of kind of where health intersects with children, and I'm going to point out some of those places where messaging pops up and maybe some considerations that we can have around that. Additionally, along with that, I wanted to acknowledge as well, in the realm of this work that we've been doing around communication and messaging, something else that we've had to really consider is the place of our health messages. And so there was a really, kind of moving and powerful discussion right now talking about trauma and mental health and what people are experiencing. And so one of the considerations when, someone like me, I'm sitting at the state health department, maybe I have certain nutrition messages that I want to convey that are really oriented at health. The last couple years, we also really started reflecting on kind of the totality of the whole person and what is most relevant when people are experiencing different things. And there's a time and a place when people are really open and receptive to health messages that are maybe more targeted at behavior change. And then there are other times where maybe we as community programs or partners, community members or peers need to offer a different type of support. Maybe it's not so much health messages, maybe it has to do more with food access or connecting with the right resources or things like that. And so that's something that has been, a wonderful part of my job the last couple of years, having the space to sort of reflect on that and think about how that impacts the work that we do. And so on the screen, right here is Ellen Satter's hierarchy of food needs. Earlier, one of our presenters mentioned eating competence. This figure on the slide is from the same person, Ellen Satter. And so this pyramid here is just showing, it's very similar to Maslow's hierarchy of needs, but just kind of acknowledging that at our baseline, what we are focused on a lot as people, like we need to make sure we have enough food, right? Like we need to make sure that we're getting fed. And then after that, we can start thinking about, acceptable food and then reliable, ongoing access to food. And it's not until you get to the top of that pyramid there where you start looking at good tasting food or novel food or instrumental foods. And really that's kind of where that eating for health and health behaviors comes into play. So this was a really valuable way for me to start thinking about, okay, the populations that I'm working with or that we are really wanting to focus on in our work, what is most appropriate for them? Are they a group that is open and receptive and is resourced enough that they have the ability to start making some of those more discerning choices about food for health? Or is this really a situation where maybe that's not going to be most relevant and what's needed right now, and we can focus differently on what some of those needs are? And so with that, what kind of came alongside that work is something that is called the language of health. It's a mouthful, the full name of it. It's the language of health, an editorial style guide to effective messaging in public health, or effective messaging for the public. And so this has been a really wonderful, tangible way for us to process and think about the way that we're communicating about our programs, about the messages that we want to convey, about the education that we think that people need to receive, and give us some tools to understand what is going to be most well received, what is going to be the most motivating, what's going to resonate the most, what types of messages are going to push people away, and what types of messages are going to invite people in. And right at the beginning of this resource, I've put here the preface, because I really love this statement here, because while the rest of the resource really is structured in a way that's like, here are messaging strategies that are effective, here are messaging strategies to avoid, and that's concrete, this is sort of the why. This is sort of that more big picture reason of why is it that important? Why does it matter if if something resonates with someone, right? Like we can have facts and convey factual information. Why does it matter that we say that in a way that resonates or not resonates, like it just is what it is. And it does matter because our words have an impact. Our words have power. And, you know, I'll just read just a snippet, but in the middle, the third paragraph down, you know, it says, by sharing clear, consistent, effective messages, we are empowered to create healthy communities. With our words, we are helping to shape the beliefs, attitudes, and behaviors of those around us. And so often when we do this work, we think about behavior change. We think about what can we do to elicit a certain behavior. And I love that this statement acknowledges that our words and the things that we do are not just impacting behavior. They're impacting the knowledge and the attitudes and the beliefs. And when it comes to health and attitudes and beliefs that people have, you know, we really do have the ability to help shape that in a way that is going to maybe leave people feeling good, feeling positive about their body, feeling hopeful about their health, feeling hopeful about their life, or unintentionally, you know, the opposite of that, or having negative attitudes about their community, about their neighbor, about their school, about chocolate milk, all of these things, right? The way that we communicate about these things has an impact. And so beyond that, there were some real concrete reasons that we wanted to do this as well. I heard Teresa mention earlier consistent messaging. We really wanted to get our arms around some of the messaging that we had. And so, you know, really tangibly at the State Health Department, we had our messaging. We also have our contractors, our partnerships with local, the health department, our cooperative extension. And that's a pretty linear line, you know, okay, this is, you know, maybe our goals, we want to make sure that we're aligned, but it goes beyond that as well, right? There's other state agencies, there's the county health departments, there's nonprofits, there's school leaders, there's parents. And so having something that we could all have that could help give us a framework so that we would have consistent messaging was something that we were really looking forward to. Alongside that, a common resource, we wanted something that could be used for multiple programs, even if everyone has different goals, right? So what's something that can help us be aligned while also recognizing that different programs or different counties might have their own specific needs or their own specific objectives that they need to have autonomy to operate in that way as well. And then thirdly, we wanted something that could help us reduce any unintentional harm that may have been coming through our messaging, and really taking the time to reflect on that and considering, okay, what is a way that we can put our words out into the community, out into the public, in a way that's going to support people and invite them into our programs and invite them into our activities, and avoid any of that unintended harm that comes along with that. And so when we were first doing this work, you know, I come from a nutrition education program that morphed into an obesity prevention program, and there was 3 arms to that work. And so there's policy, systems, and environmental change, more of that systems level thinking. There's the education piece, which is so important and I know has come up a lot today. And then that third wheel really looked at the messaging. And so the messaging strategies that are presented in the language of health in the guide, and the evidence that was looked at to inform that really is looking at those big messages. So things like social media, billboards, paid media, marketing campaigns. Think about, you know, what posters are in our schools, what's in our doctor's offices, what's on the side of a bus, what, you know, types of, you know, flyers are we distributing at health fairs, and what are the messages that we are putting onto those things that become, you know, sort of the background and like the background canvas, right, for our lives. And so the guide really covers several different topics. There's a whole section just on general health communications. So I, of course, tend to be drawn towards the nutrition and food and the weight and body size, disordered eating and diet culture. But there's some really great strategies that address just talking about health in general. So even thinking about, you know, how do we address social determinants of health and things that, you know, impact our health that people don't have control over versus individual choice and individual behavior. And how can we talk about that in a way that is not going to push people off, right? And different communities might have different needs. And so this will offer some tools and some tangible ways to think about the needs of maybe your audience and the needs of your program to help you guide and craft that messaging a little bit more intentionally. And in our work, one of the things that we wanted to do as well, when we were taking the time to reflect on what is our messaging approach, what unintended harm might there be, as an obesity prevention program, we really did start to reflect and think about, what is the impact of weight stigma and how do we begin to meaningfully address that and incorporate that into the work that we do. And that's pretty prevalent in health messaging around food and nutrition. And so it felt a little like, ooh, I heard some people mentioning like ripping the Band-Aid off or, calling it what it is and saying what's really happening. And one of the things that we had to think about was like, how do we navigate this where we want to promote health? We feel really passionate about the benefits of nutrition and physical activity and having, health promoting environments. Ooh, but what do we do about this other thing? And when it comes to messaging, something that was really helpful in helping us kind of navigate that was just recognizing that stigmatizing messages just in general are not received well. And so whether there's, there's lively discussions about weight and health and how to approach that, but from a messaging perspective, it was really helpful for us to say, okay, even from the standpoint of what's going to be effective and what's going to resonate with our audiences and invite them in, we really want to be mindful and make sure that our messages are not stigmatizing. And that came through in the research that informed the style guide. And so just really briefly here, there was a study that had lots of different types of messages, and they basically asked people to report how that message landed with them. And particularly, does this message make you want to comply with this message, or does it make you not want to comply with this message? And so there were messages just about physical activity, portion sizes, multiple broad topics, and then they also had some that were labeled just as stigmatizing. And overall, most of the messages were received well, but it was in particular, if people felt like a message was stigmatizing, or similar to, I think, what someone said earlier, if someone feels attacked or shamed in any kind of way, those were the things that it was like, whoa, I don't feel like I want to comply with that message. It's too off-putting. I feel disconnected from this, right? Opposite of the connection we were talking about. Things that were well received, talking about behaviors. What are the specific health behaviors that we're thinking about? So that fruit and vegetable consumption, messages that talked about multiple health behaviors and really, not so honed in focus on, doing one thing and it being healthy or unhealthy, but there's lots of things that we can do to support our health. And maybe not everyone can do everything all of the time, but maybe if people are hearing multiple messages and they can identify something, that feels more optimistic and hopeful, right? And messages that instilled confidence and personal empowerment, building people up, those were also the types of messages that really resonated well with people. So one of the key guiding principles or the main takeaways for me is, just really thinking that health-related messages need to be audience-focused, practical, and positive. So really relevant to the audience that you're working with. I didn't know that Coconino was the second largest county in the country, geographically, right? So that's huge. Probably messages that work in one part of the county may not be as effective in another part of the county, right? Because people are different. We need to think about our specific audience. We want our messages to be practical and relevant to, what's really going on with people's lives and what can make an impact. And then, for sure, hitting that positive note. So meeting people where they're at, providing actionable behaviors, making messages really clear, avoiding jargon and too much focus on like technical information, like really, heavy language about nutrients or energy expenditure. That's too technical. Those messages aren't going to resonate as well. And then, providing those messages of optimism and hope, collaborating with our audiences, presenting things as a choice. I love in the example of, how are we placing milk in a cafeteria, and, that just, by the very nature of having both things there's choice, right? You're respecting people's autonomy, and you can still promote health in that way, but also giving some of that, letting people retain like their own autonomy and power, right, to make decisions for themselves. And that's really important to a lot of people, and knowing those differences in your audience and your community can help you kind of identify maybe what are some of those different things to pull out. And then the other thing that is really valuable, that I think is a really good takeaway, is promoting a healthy relationship with food. And this is challenging in the sense of when we think about guidelines, in talking about nutrition or health from the top down, sometimes it can be difficult if there's guidelines about what our objectives are, right? And if we want people to eat more fruits and vegetables, over time it gets watered down to that's all we're talking about, that's all we're focusing on. And we forget about how do we promote a healthy relationship with food? Do we need to sit down with 3-year-olds and tell them all about a tomato or a cucumber and then go take them into the garden? Or can we just take them into the garden, right? And show them and let them experience that. How is that learning happening? What's appropriate at that age for kids to be learning about, whether they're 3-year-olds or kindergartners versus a teen, right? Do teens need to be understanding how to calculate calories and energy balance? Or what about cooking and practical skills as they're really getting close to adulthood and having to really take on some of those things for themselves on their own? And so, that was my own little tangent. But as to say, there's space in our work to promote health and doing it through the way of promoting a healthy relationship with food. It's okay if we allow ourselves to move away from dichotomies of what's healthy or unhealthy and what's good and what's bad. And how do we do that? We frame things with a gain perspective. People like to add. People like to hear, what can I add? What can make me healthier? People don't like to hear about things that they need to cut out, just from a messaging perspective. Acknowledging and realizing the many reasons people eat. Sometimes food is a part of celebrations, and not hiding from that fact. It exists, it's in the world. We eat for lots of different things. Sometimes we're eating for health. Sometimes we're eating to cope with stress. And that happens sometimes. And what are the skills that we can help promote and cultivate in our kids and in ourselves to navigate all of those different life situations in a more balanced and healthy way? And allowing people to choose foods that are good for the body and bring enjoyment. We don't have to remove everything in our lives that brings us joy. And also, roasted vegetables taste so good. Let's change the narrative around Brussels sprouts. What a makeover did Brussels sprouts have, right? Everyone loves them now. But when I was a kid, it was they had such a bad reputation. I'd never had one, but I knew, ooh. Well, there we go. You just throw some oil on there. Just saying. And there's a lot more in this resource guide. This is obviously just a really, really quick snippet. But here's some things that I just pulled out of things that are more effective versus less effective. So again, if you're thinking about what are the posters that we're going to put up in a classroom, what are we going to put on that flyer that's advertising a class? What messages are those conveying? Is it, acknowledging multiple dimensions of health? Is it, talking about health in a way that is weight neutral? Are we focusing on health behaviors versus a number on a scale or BMI? All of those things you can kind of take into consideration whether you're reviewing materials or whether you're in a position of crafting like your own messages for materials. And so it's been really helpful to have a resource that has helped give me some language to articulate maybe some of these things that I thought or wondered about before, but didn't always know how to tease it apart because the work we do is nuanced, right? And so I just say that as, it's a PDF, it's a digital resource. I think you find more value in it the more you get in there and start looking and having those own personal aha moments of like, oh, I see, I understand, how do I talk about health in a way that acknowledges social determinants of health, but also still gives people feeling empowered to make a choice for themselves. And it can be a balancing act. So finding your way through those nuances, that's what I'm here for though in doing this work. So I do hope to be a resource, to folks if this is interesting to you. I know this is just a sneak peek, but thinking about, we do want to promote a healthful diet. Like fruits and vegetables are health promoting. They're really good for us. But we also want to avoid that good food, bad food dichotomy. Like, how do we do that? And so we have to navigate some of those things, and it can be a little bit tricky. And so the hope is that this resource is helpful in understanding what that means for your community, your program, your work, and then also just knowing that at the Department of Health Services, that's work that we're committed to as well. And it's been wonderful the last few years to start to uncover this with partners like Teresa and so many AZ Health Zone partners and folks across different agencies, and getting some of that feedback of, wow, this really resonated with some folks, or, oh, I know it says this, but I'm wondering, in this context, in this community, someone brought this up. And the more we talk about things, the more we can uncover it all together. And so this slide, I just wanted to sort of highlight that although this work really started in looking at those big, large messaging channels, right? The social media, the billboards, the posters, there's crossover. Messaging doesn't just live in one particular bubble. And doing this work and thinking about, our campaign development and things like that, it has opened up so much space for us to think about what is the curriculum that we want to promote? How do we want to help people build wellness policies? What about our own worksite wellness at our own agency? Like, what messages is that sending out? So I just say that to share that the research that goes into the language of health is really directed at mass marketing, but starting to think about messages in this way has a lot of crossover into other areas of our work and the things that we do, and our policies, our practices, our contracts, all of those kinds of things. And that's just my crude drawing of different places on the WISC model where I think messaging pops up. So I'm not sure if I'm over on my time. These are my resources, and I know we're getting close to some networking time. This is my contact information. I would love to stay in touch if you're curious about this, and I will definitely be here until 7:30, so I would love to chat more for anyone that's interested.
Thanks for that.
Yeah, thank you.
All right, folks, so on the resource side of things, we are going to post, I know Barbara Ann had started a document with resources, so Nick has all of this. We will be posting these all to the CHER website, so you do have access to those. So I just wanted to kind of wrap it up and move into just kind of sum things up real quick. And I had more written, but I'm just going to say, I think Renee summarized it perfectly. It's all about relationships. Our words matter that we just heard from Noel. We need to listen to kids. We need to empower kids, but we also need to work together to do it. So when you hear divisive messages, we need to set that aside and come together, because it's not about teachers making decisions for kids or supporting kids without parent support. We can't do that. Parents are involved. Parents must include the teachers and the school personnel. Counties are there to offer nutrition education and support different programs that schools can't do on their own. So we need to do it together. So words matter, and we need to do it together. So that summarizes it. Thanks to all the speakers tonight. Thank you all so much.